Initiate chaos theory guarantees that we'll play like lightning shots, sounding like thunder. For every time in the face that it hits us, we're faster. Well, they should know by now. They see the world keeps trying to shake us. It only wakes us. The pendulum swings. The pendulum swings. It's in a beautiful darkness. Napoleon another. It's full steam ahead. Full steam ahead. All about the Betty Express. Misdirected from the start. It's a runaway train. I come a freight train. I come a freight train. In a beautiful darkness, the Betty Express. In a beautiful darkness.
You guys buckle in, because apparently, to end their case, the defense has decided to bring on a childhood psychiatrist to explain to us that Tanner was not hugged enough. When wanting to show where in my brain this hurts me, basically everywhere, from the outside to the daggone inside, my brain cannot deal with this crap. Yes, she is legitimately going to say that Tanner was not hugged enough. I I don't know if, but how the jury has to be done with how is Tanner society's fault, because he did in fact have, interventions. He did have, things given to him, and modalities put into place. He had a speech pathologist that went home to his home. He had, specialists and diagnoses and learning, learning modalities and adaptions. I'm sorry, but he didn't get this way because he didn't get enough hugs. And if we want to give hugs, might I suggest a neck hug? So buckle in, you guys, because they have found another penny problem glasses to explain how Tanner is not at fault. It is society's issue. Now, the one saving grace is that scuttlebutt amongst the court TV chat is that this is the last expert for the defense, and we are going to get 3 rebuttal experts from the state. Then we are going to get closing arguments. This is still the defense, yes. The defense has decided to close with a childhood specialty psychologist or psychiatrist. I can't, y'all. Reading the room is not something that happened over the weekend.
That will be helpful in making these very important decisions.
Dr. Baum, so what kind of training did you have to be able to practice forensic and clinical psychology?
Well, to be a psychologist, you go to 4 years of undergraduate. I was lucky; I only had to go to 3. I worked my way through school and through a lot of things. We only did 3 years, but I did get a BA. And then psychology graduate school is about 7 years. You have to have an internship. I went to Syracuse, New York, and worked in a hospital setting for my internship, and that's a year. And then, in addition to doing a dissertation, all of that, you need to have a year of postdoctoral residency in order to become licensed.
What in the Roz from Monsters, Inc.? Now, I do have her at 1.25, just because this isn't my robe. It's I'm feeling I don't give an F-ish right now. I had to put a sweatshirt on. I was freezing. Honestly, how many cats does this woman own? Living and dead. You know she's had those cats that have gone across the Rainbow Bridge. You know she has them lined up on her mantle. Are we looking at 25 to 30, 40 to 50, or 100? Because I'm gonna say, I'm guessing 40 to 50.
And I did that in Flint, Michigan, at an inner city hospital, working as a pediatric psychologist with children with neurodevelopmental disabilities and medical issues.
Well, Dr. Brahms, what is pediatric psychology?
Pediatric psychology is a subspecialty of clinical psychology and really a subspecialty of child psychology. Pediatric psychologists work where there are either developmental or medical complications to a child's life. Most pediatric psychologists, like when I worked in Michigan and also...
Now, it is going to come out that this particular expert has worked a lot with this particular defense team. I do believe that, again, she is another expert that is ideologically bound to whatever theory of human criminality that she has, but this this seems like it very much seems like this defense has a roster of experts who are willing to say anything and everything is a societal ill rather than a person having agency and making bad choices.
In Columbus, Ohio, we work in the actual medical hospital, on the patient floor, in clinics, or perhaps in the emergency room at times. And we look at the interaction between development, illness, outcome, and we're really trying to help kids that are either in crisis or have long-term problems, such as recovering from burns or having autism or other neurodevelopmental issues. So we're in a medical setting more than in a clinical setting and dealing with those specialized issues.
Well, why are those specialized issues important in a case such as this?
Well, I believe they're central to this case because when you have someone who's been diagnosed with a neurodevelopmental disorder, such as Tanner, it's very important to understand how that person functions in real life. The person is not just
Terribly, as a monster. He functions as a monster. We kind of already know that. That's why we're in court. I don't really give a rat's ass if he could figure out, the card reader at CVS.
a diagnosis. A person is a person. And we also have to look at
Squabob, I would like to say, now, in my own developmental issues, Mr. Mo has like, oh, this is so nice. You can put it together. The only problem is that this functionally, the model is a brain test, and I have failed it many, many times. Like if I take off one piece, I'm good, but if I take it all apart, I'm like, how does this I know what a brain generally looks like. Mr. Mo is like, yeah, you really don't have spatial recognition. But again, yes, we can all functionally understand that being neurodivergent means that you are going to have a brain that's slightly different than than typical. But to say that this is all because Tanner didn't give enough hugs or or society didn't give him enough adaptable, therapists is a load of bull hockey. I don't ask for a bunch of therapists. I don't In fact, Mr. Mo and I were talking, and I said, honestly, if we were going to do something for my health this year, I think I should probably go in and be tested and learn how my brain is functioning now and the best tools of how to use it because it has been quite emotional. Kind of going from someone who remembers all the things to not remember and not meaning to let people down, but you know, the actuality of not being able to remember things as well as I used to is that I let people down, and I don't wanna do that anymore, so talking to someone who maybe specializes in ADHD and whatever to well, yeah, I'm gonna go to a better doctor than this one, but someone to help me with tools to better organize my time now that my brain truly doesn't have the capacity to kind of function with ADHD. Which is not something that's easy. He does look like she does look verklempt. She's going to talk about Barbara. It's coffee talk. She's verklempt. Yeah, she does look like she's gonna say verklempt.
outcome. We have to understand for myself.
Also, defense expert, not that I'm throwing this out there, but clip this. Perhaps, capital murder case, don't wear white and black stripes. Not to mention, it's just a terrible idea. I know this is gonna be, but maybe next time leave the stripes alone or go zebra up and down. Just a thought.
When I look at, as a pediatric psychologist, what might their outcome can be? What interventions do they need? How do we make the progress of their life as successful as possible? Whether I'm dealing with a child who has facial burns or a child and family that's dealing with cancer and the long-term effects of that, they have neurological effects with cancer too and treatment. So what's important about the pediatric aspect of this is understanding any defendant, including Tanner, not just at a point in time, but understanding how he got to that point in time and what could have been different or made different for that particular person.
Dr. Bond, if you'll please explain to the jury a little bit about your experience in evaluating and treating children.
Absolutely. I always wanted to be a child psychologist. I ended up doing something somewhat different, but all that expertise is never, and the experience is, it still colors what I do today. So when I said earlier in my career, we're talking the late 70s, 1980s, I was a pediatric psychologist, as I stated, in Michigan and in Ohio. And then I went into private practice. I was by myself for a while and ended up having a lot of employees. I would not recommend that. But I saw hundreds of children, adolescents, and families in that private practice setting from about 1986 until about 2019.
I love that I have given my brain permission not to pay attention to her, only just casually sort of inputting the information, because I am forensically trying to figure out if that is a wig. Because if not, her stylist hates her. Why the hell would you highlight this chunk right here? Like, because there's no, like, you know how they kind of highlight, yes, through your crown, but they do a little bit throughout the rest of your hair to not make it look like you have a skunk stripe right here. Now, she's a clinical psychologist. I would think that she would be able to afford salon care, which leads me to think that this is a wig, but usually they're made better with the highlights, so I am confused. I'll be back when I figure this out.
I also, at that point, was asked to do juvenile forensic psychology. And there really wasn't forensic psychology, like formally at that point in time. But local juvenile courts were asking me to do evaluations of people, much like Tanner when he was an adolescent. Juveniles, although he did not get in trouble, but juveniles who were before the court, whether they were competent to testify, whether they should be tried as an adult, where they should be placed. And so I've had all of that experience in that area as well. Obviously, over the last 40 years, I've dealt clinically and forensically with a lot of juveniles and a lot of families and children.
When looking at cases, how important is it to involve the family as well as the children in your evaluations?
Well, it's important both clinically and forensically.
Her eyebrows are better, and I'll tell you why. Because eyebrows should start somewhat here, but not on the bridge of your nose. So hers are, in theory, where God would have put them. I do not have a problem. I mean, and as much as I make fun of eyebrows, I have one that's higher than the other. So, you know. Fair point, Gail. It's not moving as much as, nor is she messing with it, if it was a wig and it was bothering her. So it's probably her real hair.
As a clinical psychologist, Ms. Anderson, if you take your child to a therapist and they only speak to your child, that is really not fruitful. And it's also, I don't think it's professionally appropriate. The issue is none of us live in a vacuum. And a child especially is highly sensitive to a parent's parenting style, their ability to help them, their resources, all of that. And so as a clinician, I can't imagine just seeing a child without taking history and having a real knowledge of that family. As a forensic psychologist, I have an obligation to go back as many generations as I can and understand a person's history. So from a forensic perspective, it's my duty to speak to relatives, not every one of them, but pertinent people, speak to other sources of information in order to get a real holistic picture of the individual. So I would treat a forensic client such as Tanner in terms of gathering information, much like I would treat one of my clinical patients.
Dr. Bond, you said that you had always wanted to be a pediatric psychologist. In your career, have
Again, defense, I really want you to think about the fact that you are bringing on, as your final witness, a pediatric psychologist, highlighting that Tanner was failed in his childhood. That's why he destroyed and stole another person's childhood. Like I said, there was a way to present this case as the defense. They could have brought on one or two experts about autism, one expert about fetal alcohol syndrome, and explain that while it's not an excuse, this might be the reason that Tanner jumped from. And I call bull S on this. He was doing a line, and what precipitated all of this. I definitely don't think that is the real reason. I think that was a clever sort of fig Newton of the imagination of the defense to to forestall the state saying that he was hunting girls. He was covering up that camera when he was out in rural areas, trolling for girls that were left outside just playing because it's a rural area. With the sort of, he was doing illegal narcotics, the defense thinks they've wrapped up all of the prior to the uh, taking of Athena, him covering up that camera. But I think the state's done a very good job showing that there were no drugs found before or after. There was no him fiddling with his backpack.
You published a lot of papers on that topic?
Early on, I did some papers. I did my dissertation working with children who were biologically dysregulated and have hard time feeding. It's called non-organic failure to thrive, where you have problematic parenting and a child who has some type of impairment. Looking back, probably something like Tanner's, and working on a program to help them be able to eat and relate and function with other people. More recently, I've had peer-reviewed publications about trauma in the courtroom and how that's assessed. But I've also written a lot of books on educational psychology.
Please, pray tell me, are you talking about trauma in the courtroom being the families that were affected by people who did crime? Or are you talking about trauma to the criminals? Because, ma'am, again, this is the wrong time. This is the wrong place. This is the wrong platform to want to talk about, well, maybe people have mental health difficulties and that's why they intersect with the law. We can have that discussion somewhere else, not here, because I agree there might be valid points.
Taking skills, anxiety management, that type of thing.
Now, you practice in Ohio, so I assume you're licensed in Ohio.
Yes, that's correct.
Where else are you licensed?
I have a full license in Texas, obviously, and I've had that for many, many years. I'm licensed in Idaho, and I'm trying to think where else I'm licensed. Texas, Oklahoma as well. And then if I need to go to other states, I get a temporary license.
You talked about doing forensic psychology, and that involves the courts, right?
Yes, ma'am.
All right, so how many times have you testified in proceedings?
Many times. Not obviously as many as I've evaluated people, because many times cases get settled or other things happen. But I have been in state courts, federal courts, even military courts. I would say I've testified maybe 100 times. That's a guess.
Oh, I'm sorry. What about juvenile court?
Many times.
And why is that relevant to a case such as this?
It's relevant because I've done so many juvenile evaluations, especially earlier in my career, that to understand how a child develops and where they are at a point in time and what their choices really were. What do we do with a juvenile who has not had the family background that all of us may have had?
Again, the irritation I am feeling is because I do think that there are a lot of places where society and culture and personal accountability we need to have some rough conversations. We need to maybe talk about, hey, if you're not a good parent, maybe there should be a license or something for this. Because legitimately looking objectively, Tanner's family, both sides, neither of them should have had any children if we were basing it on stability and the ability to have children. This is an important conversation to have, but this is not the time nor the place. This is not the poster child for early childhood intervention that you want.
How do we give them interventions and keep them out of that system? All of these things are very relevant. So this whole issue about development has a great deal to do with many cases in juvenile court, and I think many cases in adult court as well.
Do you often deal with cases involving capital murder?
Yes, I do.
How often?
I don't know if I can answer often. I can say that I've been involved in approximately 50 cases over the course of my career. Many of them do not go to trial.
May I approach your honor?
Yes, ma'am.
Dr. Rollins, I'm going to hand you what has been previously marked as defense exhibit number 47.
Yes, ma'am.
Do you recognize that?
Yes, I do, ma'am.
What do you recognize it to be?
This is my resume, and it is 27 pages in length.
Is this a true and accurate representation of your experiences?
Having spoken to my office yesterday, I would say yes, it is.
Okay. Your Honor, at this time, the defense offers defense exhibit number 47 for all purposes.
I've seen the judge. Object. Defense 47 is admitted.
Dr. Rollins, I want to talk to you a little bit about the case involving Tanner Horner.
That's fine.
You were retained by the defense in this case, is that correct?
Yes, ma'am.
All right, so, Director Bronze, how much is your hourly rate?
$350 an hour.
Is the standard
Texans, I don't know if you're boiling pissed off mad. Look, I'm not going to make assumptions for all of Texas's taxpayers, but my guess is that you're getting if you're watching this, you're getting a little peeved off that nearly $300,000 has gone to the defense of this monster. Now, I'm terrible with math, but it was nearly, or maybe 200K. I'm really bad at math, but she has hundreds of hours in. Hundreds, according to her. At some point, if they can't find experts in Texas who are willing to co-sign their crazy theories, I think that it should be addressed, how much does the taxpayer have to foot the bill for this crap?
for experts in your field?
There's a wide range. I would say that I'm at the lower end of a range for forensic experts.
You sure would.
Approximately how many hours have you put into this case so far?
Well, that's hard to estimate. I know what my billing is up to this point, like just before this week, but I put in many hours into this case. I've traveled, I've spoken to witnesses, I've spoken to Tanner, I reviewed volumes of records, so it's many hours.
What have you billed so far?
So far,
RJ, NLC, we are not missing much. Now, the scuttlebutt is that this is going to be the last expert witness for the defense. They're going to rest. And then the state has 3 rebuttal witnesses. Thank Jeebus, talk logic to us. And then we will be going on to closing statements. Now, whether we will get to all of that today or at least have a better guideline, that is sort of the scuttlebutt. Now, why the defense would decide to close their case in chief with a childhood psychologist to talk about Channer's childhood in a case in which he stole a childhood from someone else, I don't know, but reading the room has never been the defense's strong suit. Now, I have opined on the number of cats this woman has, and I'm saying 50. And I'm saying both alive and dearly departed. She's had 50.
and this is just an estimate, until this week for preparation, over the last 2 or 3 years, I billed $28,000 and then some expenses for flying and hotels when needed.
One thing I didn't ask you before, but I'm curious, is do you accept every case that you're approached to take on?
No, I did not.
How do you determine which cases you'll accept and which ones you won't?
Well, first, I mean, ethically, if someone asks me to do something that's really not in my wheelhouse, I would not try to ever go to court with an area that I'm just not familiar with. I also talk to the attorneys, and if I believe that the attorneys are asking for something like to be their mouthpiece, I have attorneys call me up and say, oh, just go to court, this is what I want you to say. We politely not only hang up, but do not use them again. So yeah, I would say, Ms. Anderson, that not just capital cases, but all cases. I do civil cases as well, like personal injury and workplace issues. I would say I turn down about 15% of the people that call me.
Why did you accept this case?
Well, first of all, when your team first spoke to me about it, you mentioned your concerns about development and your concerns about neurological issues such as neurodevelopmental disorders. And I knew that I had a lot of experience and interest in that area. I also know that your group does a very comprehensive job of getting other experts, that I would not just be on my own in doing this, but I would have solid information to back up my testimony.
Again, it does seem like, and this is why in a little bit, I do want to see another case with this defense team involved, because it does seem like the defense team, this might be, a defense team that works on a lot of capital murder cases. So I want to see if this is sort of their, go-to method or tactic to attack, the mental stability. And because it does seem like, for all I have made fun of the defense, this does seem like they are very prepared to ask these type of questions from their experts. So I want to see if in maybe a less charged case, I find this kind of defense as repugnant as I found it here, because I will be very real. I do not have chill for this defense. I think that they have put this defense on disrespectfully and horribly. That being said, this is a kid case. We've seen the audio, or we've seen the videos, and I've read the transcripts. I don't think that I am the non-bias, kind of litmus test here. So I do wanna watch them in another case, to see if I am as scathing as I have been here, because I am not unbiased in this case.
Money. I had known you before, you seemed very determined to do the best job you could, and I felt very comfortable doing this.
All right, so let's talk about the case itself. What were you asked to do in this case?
In this case, I was solely asked to look at Tanner's developmental history and how that impacts his functioning over the course of time and prior to the offense.
When you look at a case and agree to accept a case, what is your process? How do you begin your evaluation?
Well, generally, I ask whoever it is, either defense or prosecution, I ask them for, or whatever attorney, for as much information as possible to get ready to see a defendant or other, what we call collateral sources. So I ask for everything. I don't want things in a summary. I do not want an attorney to summarize records for me, because I need, as the expert, to have availability for those records.
What's going on?
Okay, some experts want to have a summary. I don't do that. Obviously, I don't need to read every page. If it's a medical record, for example, and they repeat the person's name and address over and over again, I don't need to spend hours billing for that. But I need to see information because I, as an expert, have interest that might be different or a need for certain information than, let's say, an attorney. Okay?
You mentioned a summary, and you don't rely upon summaries. Why is it important to have the actual record and not just a summary provided by an attorney?
Well, first of all, attorneys are not psychologists. And the things with information that an attorney might summarize may not be the information that's relevant, those key factors that might be relevant in expanding my understanding of a particular defendant or person. So I need to be able to look at those records myself, and my job is to come up with hypotheses. As I sit at my desk and look at records, I don't just read. I keep thinking about, in this case, Tanner, in the situation. What are those records telling me? What other information might I need? How are those records written? What does that tell me about this case in full? So it's very important not to just see the summaries. Now, obviously, if there's a surgeon and there's a surgical summary, that's the summary I get. But in terms of other information, I need to have a hands-on with the information provided, the whole file.
In this particular case, were you provided records?
Yes, ma'am.
What kind of records were you provided?
All kinds of records. First of all, I had a lot of law enforcement records. I had videos of Tanner's interrogation. I would say that with S, interrogations. I had the video, obviously, of this terrible crime. I was given his school records, medical records, his jail records. I had interviews, transcripts with other people that are involved in this case. I just had a voluminous amount of information.
So it sounds like the records that you received.
Interesting, because one of the things that I was waiting to hear is whether she did watch the infamous tape. Because, I think that definitely puts into perspective what they have, as far as really an idea of what happened in this case. Because I do think that the defense has sheltered a lot of their civilian witnesses from the reality of what happened in this crime. Now, not so much the experts, but having watched those tapes, and I know that the state's probably going to ask her if she's watched that particular tape. I do have a hard time continuing to have this stance that Tanner was let down by society, and that's how he became a monster kind of ethos that argument we're trying to put out here.
Were kind of a combination of the state's discovery and the defense's investigation?
Yes, ma'am, I would say that's a good summary.
Why is it important to have both, for both sides?
Because my job is not to take sides. My job is to understand this case in full. And the other issue is that law enforcement records can give me, as a diagnostician, or at least a developmental expert, information about that particular person. So the way the crime is committed, but also how they act toward an interrogation, how they act toward police officers. All of this information is very central in understanding, in this case, Tanner as a whole.
Did you rely solely upon the records themselves?
Of course not.
What else did you do?
Well, I met with Tanner for approximately 12 hours over the course of this investigation. I also met with his mother. I met with his grandmother. I met with his brother. I met with some friends of his. I met with a paternal aunt. I met with one of his special education teachers. I also met with the mother of his child. So I've really had a comprehensive view in person of people's attitudes about Tanner and about their experience with him.
Dr. Bond, you said you met with Tanner for about 12 hours. During these meetings, did you perform any testing?
That wasn't my job. And no, there was so much testing performed that there was no reason to do that.
Did you review the results of the testing that was performed by other experts in this case?
Of course.
Did you review the reports of other experts in this case?
Yes, ma'am.
I want to talk to you a little bit about the visits that you had with Tanner. You said you visited with him for about 12 hours. How many times did you meet with him?
Well, I met with him, I was supposed to meet with him 3 times, and I had that blocked out. It turns out that I met with him once, and then I met with him on a longer day because we could not get an interview room while I was in town. So I met with him actually on 2 occasions. It was supposed to be 3, but it did not work out that way.
So 2 occasions, but 3 sessions?
Basically, yes.
Okay. And where were you? Where did you meet with Tanner?
I met with Tanner at a private interview room near the pod where he's incarcerated. We had privacy. The door was shut. The chairs were comfortable. It was, for a jail setting, a very conducive.
Oh, well, goodness sakes, I'm so glad that his tushy was safe. It's these random asides people put in, and I know I do it all the time, but the chairs were real cushy. Good to know.
To having a private, interview with any defendant. We could hear each other, see each other. It was fine.
Why is that important?
Because when you were trying to interview a defendant through glass or through one of those telephones, you really cannot get into the intimacy and depths of their life. You cannot do that through a telephone or through a glass barrier. It is a relationship. When I meet with somebody like Tanner, we have to be able to see and hear each other, to actually be in the physical presence of each other, because it is not just.
Ew, why is this making me grossly uncomfortable? It's an intimate relationship. This is why I can't do therapy, because the moment they start talking about intimate relationships, I'm like, nope, I'm out. I don't even know you. We haven't had dinner. I'm not even married, to you. Ugh.
An interview for facts. It's my ability to develop a relationship with Tanner or another defendant, and in that relationship, understand how he functions. It's one more very, very important piece of evidence.
Could the fact that there were other people, let me back up and rephrase this. How would the presence of other people in the room outside of the team, how could that affect the validity or the rapport building?
I'm not sure I'm understanding.
I
We
know.
spoke privately. There were guards outside, but they could not see in the room.
Would having the guards inside the room impede your ability to conduct a thorough evaluation?
I would not have conducted an evaluation under those circumstances. There would be no way that private information, not just from a legal perspective, but very sensitive information, no defendant would ever, especially in an incarceration setting, divulge issues of vulnerability.
Have a great lunchtime. Thank you, Wolfram, for the Modly Mods. Yeah. Oh my goodness.
Or loss or weakness or anything. So I would have probably asked you to find a court order that a guard should not be in there, because I could not conduct an evaluation like that.
How important is it? You mentioned the word rapport. So how important is it to build rapport with the person you're evaluating?
Well, I think it's important to define the word rapport. My job in this is not to become friends with Tanner. My job is to set up an ambiance, an environment where Tanner or other defendants will feel comfortable talking, which means that I try to make it clear that they're accepted by me, that I have a lot of experience, that I'm not here to be criticized or judged, but I'm here to fully be a listening ear to understand. And that, yes, I may ask questions that are going to be painful, that are going to be embarrassing, but I'm hoping that there'll be a level of trust and actual likability between us that a client or a defendant would divulge such information.
During these evaluations and these interviews that you do, how important is it to get that personal information from the client?
It's crucial. If you went to a therapist and you did not feel comfortable with that therapist, you would not divulge information that is highly personal. You would not feel comfortable with that person. There's a big difference.
He admitted to unaliving a little girl. I really don't care about his comfort when he's divulging his fifis. I really don't care if he had the big, sad, low T or, an undiagnosed lemmy-winks in his bowels. I really don't care. In fact, let's hear more. Make up a diagnosis where he had lemmy-winks. And in fact, we should just watch lemmy-winks. We'd get more out of it.
I get asked this question a lot between caring and likability and respect. Okay, I want this to be a respectful relationship. It's fine to tell some jokes sometime, and Tanner sometimes says things that are a little bit off the wall, and that was fine, but it has to be a level of trust. And that it's not a therapeutic relationship. I'm a forensic psychologist, but it has to be that he knows that I am listening and that I will ask questions that will allow him to tell the whole story about himself.
Is that another reason why it's important to have your privacy and not have other people in the room with you while conducting these evaluations?
Absolutely.
Dr. Bonds, let's talk about child development, because that's why we're here, what you were retained to talk about. When we talk about, and when we use the phrase child development, what do we mean by that?
What we're talking about is the trajectory of someone's life. We're talking about what happens, first of all, in the
Well, wait a minute. Go back to trajectory. I have a trebuchet. Well, I don't have one, but I know that we can make one. I am willing to test out Tanner's trajectory. We will get Judson Welcher out here. We will get blue paint. Ma'am, I have never loved a defense expert more. Talk about his trajectory. And we can try multiple times.
womb in utero, which obviously is very significant in this case, but also historically. What are the people like that raised a particular person? What histories do they have? Obviously, in this case, both his mother and grandmother had problematic histories. Doesn't make them bad people, but they do. And then we look at stages of development. Every child, whether you live in Fort Worth or you live in, West Africa, goes through similar stages of child development, of where there's certain milestones and certain critical stages of life that children have to go through, hopefully successfully. And then we look at adult outcome and what skills and strengths they had or did not have as a child to have a successful adult outcome. So development is looking at the whole course of someone's life and trying to understand at every point why things were either successful or why they might have been problematic.
You had mentioned in utero. Does that mean that development begins before birth?
Well, it begins genetically as well, but yes, significant issues can occur when there are prenatal complications.
Dr. Brahms, you talked about there being stages of child development. Let's talk about those stages, okay?
That's fine.
What is the first stage of child
Again, the problem with the defense is that he did have delayed milestones and they caught them. That's why he was given the diagnosis of autism spectrum disorder or Asperger's. They noticed that he was not developing, so they put him in with OT and first steps. He was identified as having developmental issues and he was given support. So this whole, his family didn't help enough and this didn't help enough. We did as much as we could.
development?
Well, the first thing a child has to do is they have to be able to attach to others. And in order to attach to others, you have to have a caregiver that is there for them on a consistent basis. It doesn't mean they have to be perfect parents. None of us are perfect people, but it means that they have to respond to that child's needs. It's reciprocity. It is the give and take between a parent and child. And in order to do that, you have to have a parent that is emotionally and psychologically available without their own problems to actually respond to what a child needs. And it's very simple. A mother needs to be able to touch the child's face, and then the child touches the mother's face. The mother smiles at the child smiles back at the mother. But to do that, you have to be consistent, and you have to have the ability and knowledge to do that to an infant. When those things do not happen, with a regular child, not somebody who has a neurodevelopmental disability, when that doesn't happen, the child becomes very agitated. They cry a lot. They scream because the parent is not there to modulate their emotions. When an infant knows that there's a caregiver and the world will respond. The purpose of parenting in those first year is to teach a child that the world will respond to them and that they don't have to go to desperate measures to get the world to respond to them, that world will be responsive. So that first period of attachment is significant as a building block for the rest of
Yes, and it is something that they have studied in World War II time when there were a lot of babies that had lost both parents and there simply wasn't enough staffing for all of the children. There were noticeable psychiatric differences and measurable differences in outcomes for children that were not nurtured that way. But Again, J.K. Rowling, I don't give a crap why Voldemort became Voldemort. He became Voldemort and then he gets to go, okay? I don't care about his backstory. I don't care that his mom, decided to roofie a guy to get him to marry her. That's not my problem, all right? Voldemort is a douchebag and he should be adjudicated such. I don't care about his history other than in a more academic, we might need to deal with these problems in society at some point reference.
someone's life.
Dr. Brahms, you mentioned neurodevelopmental disorders. how can a neurodevelopmental disorder affect the development of a child?
Well, profoundly. I mean, I know back in the mid-70s, I was doing research on how children who are not, we call it biobehaviorally regulated, how that affects not just attachment, but it also affects the rest of their development in their life. So when we have a neurodevelopmental disability, one of the impairments is the ability to self-regulate. Now, Ms. Anderson, in the olden days, okay, even more olden days than me, okay, you were able to do evaluations on infants, and they had a pinprick of an experiment where you take newborns and you.
What the hell is wrong with psychology? Who the hell decided, you know what, we should do an experiment where we prick babies? And everyone thought, that'd be great. I wonder what we could learn. What is wrong with you people? Because you know what? When I think of an experiment, I think, oh, let's do something like true crimey. I don't think, hey, let's stick an infant and see what happens to them. Soft sciences, I'm looking at you and I'm starting to get concerned.
Prick their heel just a little bit, little needle. Some children didn't even notice it. Some children cried, but then they put their hand in their mouth and self-soothe. Soothing is not something that people with neurodevelopmental disabilities do. Tanner has never self-soothed except in very immature.
Wait a minute. No, because self-soothing are like those, again, in autism, they're somewhat noticeable. They're like the hand flapping or the, tics or something like that. So to say that Tanner was precluded from self-soothing because he has autism, no, he did self-soothe by punching himself, which again was destructive. But that's how this woman is annoying. And welcome, Flux Raiders. We are allegedly finishing up with the defense's final expert. She is a childhood psychologist, and she is explaining how Tanner turned out to be Tanner because he didn't get hugged enough. Now, that is me paraphrasing sarcastically, but legitimately, that is the gist of this. Society failed Tanner, so he became a monster. So, how do we, society, take responsibility for our failures? Has legitimately been the defense's, thing.
Ways. Some children will just cry and cry and cry. So much of this is related to, some of it's we call temperament, but a lot of it.
And Miss K. Grift, I'm going to go against chat just a little. I'm not sure she's justifying what he did. Admittedly, she's the only witness I've seen. It seems, and you are right. She's actually, for as much as I'm dogging on her, one of the better witnesses. But we've legitimately had 4 witnesses now on the stand say that his taking of illicit drugs near the time, and as the defense has brought out that he covered the camera to take a line of cocaine, and Athena saw him, and that was the nexus, the start of all of this. He abducted her because he thought that she saw him chewing drugs. The other experts have legitimately basically made this an excuse. That being said, she is one of the better experts that they've had. I do appreciate how thorough she's been, but yes, she is probably getting more hate because she is the tail end, but we have legitimately had a witness, a pediatric respiratory doctor who specializes in fetal alcohol spectrum disorder, claim that Tanner's poor occupational therapy, his hand weakness, that indicated that he had hand. Sorry, I froze. That indicated part of his diagnoses because of the weaker hands. It's things like that that are really disheartening, and the fact that all of the experts listened to the audio or read the transcript, and they were still able to, again, blame everything on his diagnoses, not his choices. And I think that's the big irritation, is that, yes, we can agree that there are structural abnormalities in his brain, but at the bottom line, at the end of the day, he made choices and got himself here. It's not like, the autism came out one day, put on a cloak, and decided they were going to go crime. So that's kind of what the frustration has been. A lot of Tanner is the real victim.
It's just basically brain development. So it does matter because a child who is neurologically impaired is going to have a harder time when that comfort and that reciprocity is not there because they can't comfort themselves.
So how important is it to, well, let me ask this. Are interventions available for children?
Oh, absolutely.
How important is it to have an intervention as quickly as possible or as soon as possible?
Well, I don't want to be unpolite, but it's not an intervention. It's a course of interventions. It's a multimodal intervention. So first of all, the timing is extremely important. It is important to start as soon as you see developmental differences or behavioral differences in a child. In many states, most states, there are infant programs where people come into the house, professionals come into the house and educate the caregivers about how to set up the best possible environment for that child. But what we do know in terms of early intervention with neurological disabilities, neurodevelopmental disabilities, that if there is not intensive intervention by about age 6, that child is far behind the 8 ball. That the types of skills, attention, self-regulation, socialization, attending to the environment, all of those issues need to be addressed well before a child starts to go into stages of development where those skills are absolutely mandatory. So if you do not have intervention early, and that would be occupational therapy, counseling for the parents or parent guidance, educational issues, there's a lot of interventions. If you don't have that early on, everything snowballs because that child doesn't have the basic, we used to call it learning to learn skills. The skills that you have to learn in this world, to acquire information, to control your behavior, all of those things. If you don't have that by a certain time, your adaptation and your coping skills are going to be ineffective.
You mentioned the term multimodal. What does that mean?
Well, it's a fancy word, but what multimodal means is that you have interventions not just in one area, but in many areas, because neurodevelopmental issues are pervasive. And what we mean by pervasive, it's not just a learning disability.
But again, Tanner had these. He had an occupational therapist. He had a special education teacher. At that time, I think they were called special ed. He had multiple different, because within special ed, you've got occupational therapy, you've got speech therapy, you've got behavioral modifications if you need them, you've got psychiatry. So he was not getting, left behind or left out. He was getting what a bunch of other children with his diagnoses got in those days.
I have friends who actually became attorneys and doctors. They had a learning disability, and they got reading help, or they got whatever they needed, and they went on with their lives. And some of them they listen to audiobooks now because they don't like to read that much, but they still become lawyers or doctors. That's a learning disability. What we're talking about, and I know this jury has heard this forever, but we're talking about deficits that are pervasive. They're in the frontal lobe. They're in the limbic system. They affect the way that somebody perceives and interacts with the world. So there's language deficits. There are occupational deficits in terms of learning to learn, learning how to pay attention in school, getting other skills, whether that's baseball or handwriting. And then, of course, a very important core is the parenting issue. Those parents, because the people who really intervene emotionally as well as functionally, like teaching children, are the parents. And they are probably as important or more important than any of the other interventions that are available.
You mentioned occupational, you mentioned learning disabilities, you mentioned teachers. What other kinds of interventions are available for children with neurodevelopmental disorders?
Well, there's psychiatric interventions. There's always the option of medication. And this is an important issue because, number one, a majority of children with neurodevelopmental issues have, in quotes, ADHD. They do not pay attention. They are impulsive. It's all of that. We can use whatever diagnostic terms we want to use. I usually don't say ADHD because I think it's part of the whole neurodevelopmental issue, but they have those problems. And you can treat that with a wide variety of medications. The secondary problem comes is that children who live a life with this type of impairment develop secondary diagnoses like depression. That's certainly true for Tanner. So we have to look very carefully at controlling those, or at least remediating, addressing those secondary diagnoses. Because then when you have a neurodevelopmental disability or impairment on top of a secondary problem that's major, now the problem, it's not just additive, it's interactive.
What do you mean by not just additive, but interactive?
Because what happens with this group of neurodiverse people, especially those, here comes another clinical term that we call level 1, higher functioning people with a normal IQ like Tanner, is they tend to get overlooked. And what happens is they're oddities. They're oddities in their family, they're oddities in the world, and they develop secondary diagnoses like depression. And then the more depressed they get,
Hey, how many among us in chat are the odd one in their families? And how many of us odd ones in their families never did anything to harm anyone? We're a little odd. We have our little quirks, our little things that we just, are quirky about. But, for some odd reason, without, society having to tell us not to, we managed to stay out of felonies.
The less they function well in other areas, and when they function less well, then they become more depressed. They turn to drugs sometimes. Substance abuse is common in this population, especially these higher level functioning people, because they are not out there. No, everyone expects things from them that they can't do. And so they try to mimic what they can do, but they can't do it, and everything snowballs. And so these are serious issues, both in terms of medication and other interventions.
Dr. Brahms, I want to take you back to the stages of development. You had mentioned attachment. Is that the phase also where children start learning how to explore the world around them?
Yes, after a child hopefully becomes healthily attached to the world, there's a stage called autonomy. And autonomy is, anybody who's had a toddler is going to understand autonomy. You don't need a lecture about this. Children, let's say 3 years old, 4 years old, young, toddlers, a little bit above, will go out to the world and explore. And who do they come back to? They come back to their mommy or daddy. And their mommy and daddy tells them how to explore the world safely. If you want to look at a flower, you go look at a flower in the garden, but you don't rip it up. And you get compliments from your mom. You went and smelled that flower, but you didn't take that flower out of the ground. That is really grown up on your part. And then the child comes back to the parent for that compliment, and they get a hug, then they try to explore something else. So in that stage of autonomy, which is sort of toddlerhood, preschool, they start to learn how to deal with the world with their emotions being controlled and with their behavior being controlled, because there's a solid parental figure, a solid caregiving figure.
She also doesn't really point out, but around 4 years old is where you'll start seeing kids, and I'm saying this as a parent, you'll start seeing kids start to understand that other people have feelings just like them. Now, some kids might be just naturally intuitive and kind of perceptive like that, but I noticed with my boy children, it took till about 4 that they realized, "Oh, if I take that toy, that other person will get mad because I would get mad if someone took my toy." And it still had to kind of go back to their personal feelings if it happened to them, but that's about the time where you do start, "Oh, if this happened to me, I would feel blank. If I did it to someone else, they might feel blank." So, that is an important thing, and that would should be something she brings up.
Who is there to guide their behavior and give them that feedback and that reinforcement, that guidance. So when they go out to the world, their behavior is controlled. They can look at their environment, they can enjoy their environment, and they get attention. And I don't mean spoiled attention, but they get attention from a caregiver that they are able to be the big boy or big girl and do what has to be done to start to be part of this larger world around us.
What happens if you don't have that kind of solid parent to help you during this stage?
And what happens if you also have a neurodevelopmental disability? I mean, those things are going together in this case. What happens is children who do not have that guidance do not know really how to control themselves. Children who are neurodevelopmentally more normal may have less trouble doing those things. But when you have this hyperactivity and this impulsiveness and this generally agitated state, and when you have a family who can't give you what they need, then your ability to be able to go out in the world and act in an appropriate manner and not be afraid or not be overly inappropriate, that is compromised.
And so in cases where you have a solid parental figure that can help navigate that aspect of child development, is it easier for a child with neurodevelopmental disorders or issues to succeed?
Well, let me phrase that the opposite way, is that when a child with neurodevelopmental differences does not have steadiness, when they're moving all the time, for example, if the parent is on drugs a lot, if there's different people in the house, if they have different caregivers, they are getting the opposite of what they need, because a child with these disabilities needs predictability and stability and responsiveness. So predictability.
Okay, again, so are we going to charge the mom? Are we gonna charge the grandma? Are we going to charge, I don't know, 170 people back in the generation until we find the one sober guy who started this cycle of destruction? Where at any point along this generational saga do we get to hold someone accountable?
Stability, responsiveness. That is what is going to modify their neurological damage. Now, all children need that, Ms. Anderson. I'm not saying that we should let other children just do what they want. But in terms of pervasive developmental issues, it's very important to have that stability, that predictability, and that responsiveness. If you don't have that, the brain does not have a way to modify. I'm not saying heal. I'm saying to modify and have that child have the ability to use all their ability and their skills to have a more adequate adjustment and successful adjustment.
Hang on just a minute. We have a juror who's requested to take a short break. So let's take 10 minutes. We'll come right back in. Okay.
The jury's like, we're done. We want to leave. Why can't we leave? Why won't you let us be? Now, there is this little weird bit that we got here. And I don't know if Court TV was having shenanigans issues or what, but we do get the start of this woman's.
81.
You mentioned clinical psychology, but I also heard you say forensic psychology
Yes.
earlier. What is the difference between clinical versus forensic psychology?
Well, there's a large difference. Obviously, to do either, you have to have a great deal of experience in understanding human nature. Science is a scientifically based profession. But in clinical psychology, the client is your client. You are their advocate. And so that is why you go to counseling, because you want somebody to be your advocate. Obviously.
And to the point that Court TV is showing, I could not imagine having to sit here. Now, this is basically what we didn't get, and then they go back to break, but it just repeats that little bit that it got cut off on.
In the household that Tanner grew up in, did he have stability? No, he did not. Did he have stability?
We're talking early on. No, it got a little bit better later, but no, in his early years, he did not have predictability or stability.
What about responsiveness?
Minimal.
And how can the lack of predictability, stability, and responsiveness impact a child like Tanner with not just one neurodevelopmental disorder, but he also, been diagnosed with autism, been diagnosed with fetal alcohol spectrum disorder, and other issues? I mean, how does
We're talking about multiple negative effects. So when you think about what Tanner did not have in terms of the family structure and stability that he should have had, what happens to any child, not just Tanner, is that your ability to get what you need in an adaptive way becomes very limited. There's a lot of attention seeking, whether that is acting out in some ways. Like I know that he tried to lit a field on fire. I don't think necessarily on purpose, but he did things that were not.
Again, he lit a field on fire. Why is it not on purpose? Why was he not purposely playing with fire? Why are we continually taking agency away from Tanner? Well, he has autism. He doesn't know what he's doing. I mean, essentially, that's what you're doing. Every single expert has, whenever, acting out happened or he did something, not criminal. I mean, it's just mind-boggling the amount of excuses these experts are giving him. Now, what will be interesting to pay attention for the state, the defense has been very clear to ask each and every one of their mental health experts whether Tanner tested for antisocial personality disorder, for sadistic sexual proclivities, to include a paraphilia for young children, so an abnormal fetish, basically, along with sadistic sexual proclivities. Those are usually some of the big things that do go into determining future dangerousness. And we've noticed that all of the experts on the defense's side have said he is not at all, he didn't test for that. He doesn't have the symptoms. I am guessing that these are going to show up very big in the state's experts. Well, now 0 has either been a way that Tanner could confess without confessing, or he's a liar, but people on the spectrum lie. I mean, basically anything Tanner does is because he was self-medicating. It's because of the spectrum.
Smart things to do. Children with neurodevelopmental disabilities also do what we call telling tall tales. They tend to exaggerate. They tend to say things because they want to be something that they're not, because they're not getting that sense of self-worth from a family that cannot respond adequately to them. They also tend to find themselves absorbed in fantasy, because fantasy is much better than the reality that they have. And for Tanner, it's an interesting situation, because most of the cases I get are where there's profound abuse. Most of my cases, whether they're capital cases or other cases, these are children that are beaten, they're hungry all the time. There's obvious abuse. The thing with Tanner and his family is the deprivations were smaller. They were subtle. They were mom being incarcerated, not being there. He never knew. He told me he never knew where his mother would be. She might be on the streets, she might be incarcerated, or she might be home nodding out in the bathroom for him to find. So in terms of the way that he looked at the world was not in a stable, predictable way. And as such, his behavior was not predictable. Part of having autism or fetal alcohol syndrome or being on that spectrum is not being able to look at cause and effect. In his family, people really didn't talk a lot about cause and effect. His mother did what she wanted to do. And I don't dislike his mother, Melissa, at all. But she...
Oh no, I'll do that for you. I dislike her because of her stupid, selfish choices. Cut her out of Tanner's life if she was a maladaptive figure in it. If she was the lack of stability, no one in that family thought about cutting her off for the sake of the child.
Has never been able to get her life together, much be able to parent somebody, anybody, much less somebody with a pervasive impairment. So when we look at this lack of predictability, it's hard enough for, in quotes, a regular child, but it's much harder when your brain cannot make sense of the world around you to begin with. So what makes this situation with Tanner so important to understand is that we're looking at subtleties. We're looking at brain impairment. We're not looking at gross abuse, but we're looking at abandonment, being babysat by a 10-year-old, not knowing where your mother is, having a father who doesn't care about you, being with a, in quotes, stepfather who is a meth addict himself. There's all of these things that it'd be so easy for me to sit here and say, well, you know, he was beaten every day and he was locked in a closet. That is not true. What happened in this case is that his brain was neglected. This is a case of brain neglect. It's not a case of abuse.
Oh, brain neglect. So they didn't give him a Rubik's Cube. They didn't let him watch Jeopardy. I don't flippin' care.
But in that way, in all the 44 years that I've done this, that is abusive. It is a neglect of what gives somebody the opportunity to develop to be a fully functioning adult.
Dr. Baum, let's talk some more about the stages of development.
Certainly.
After a child learns autonomy and begins to explore their world, what happens next?
Well, the next stage that all children confront is mastery. When you start entering elementary school age years, you have to learn how to master the environment. Some of that is reading and writing, because from an educational perspective, you learn more basics between first and third grade than you do for the rest of your life. You're learning how to read. You're learning what mathematical principles are. It's the basis. Very important years. But you're also mastering your abilities to be socialized. You're mastering the ability.
Where's the part of the brain for spatial distance? Because I'm pretty sure I'm feeling a migraine starting right about here in the temporal lobe. So now I don't know if we'll get all the way to the cerebellum as far as the level to which the stupid has descended, but we're a good temporal lobe. So, then we need the frontal, the occipital. But we're starting out strong. The frontal lobe, where all reasoning is being attacked.
To be part of a larger world around you. That is basically what kindergarten and first grade is about. And yes, it's about ABCs and it's about learning numbers, but it's about how do you learn to be in the larger social world, to hang up your coat, to put your boots in a locker, to sit there with floor time and be with your friends, to learn how to interact with people, to be quiet when you need to be quiet, to ask questions that are appropriate. I mean, we know how many little kindergartners say inappropriate things. We've all had kindergartners. They say things that it's because they're kindergartners. And we teach them in a loving way why that would be appropriate or not appropriate. Tanner, in reality, as an adult, doesn't have much of that. Sometimes when I talk to Tanner, I feel like he walked out of a textbook. That this is something that, if it wasn't a capital case, I would use when I teach law school. I mean, it's a typical case of children who have not been able to master their social abilities and master that part of the larger world. And all of us want to master things. Just as an example, I can't take a survey in a courtroom, but I would imagine that most of us have collected something at age 6, 5, 6, or 7. I know that for me, we used to take our bikes and collect pop bottles and return them for like 2 cents. Some people, I didn't become rich, but it was interesting. Some people collect rocks. Some collect Matchbox cars. Because why do little kids collect? Because that is their world that they can master. These are my Matchbox cars, or these are my rocks, or these are my throwaway Coke bottles. Okay, these are my pieces of glass that I put on my shelf that I found going around my neighborhood. So that sense of mastery makes you feel confident because I can do something. I am a little kid and I can do something. And you feel confident. You feel like you have skills. I'm able to do these things. When you talk to people about Tanner, and when you talk to Tanner himself, that sense of mastery was not there. He was the one who was continually bullied. He was the one who never could do anything right. He was the one that didn't have parents. Probably he had grandma on and off, but he didn't have a family that taught him to be competent and confident. And when you're not taught that, later in life, you act like the age that you never got that at. So there's times when I talk to Tanner, I literally can believe I'm talking to a 6-year-old in terms of inappropriate comments, not sexual ones, just inappropriate comments, laughing.
Glad you had to put that in there. Again, you have to put that in there because this man is not so deprived that, and told this story before. I worked with people with more severe developmental disabilities. We had a gentleman whose mental age was 6, and we had to keep him away from any areas that might have young people there because he was inappropriate. He did think he was 6 years old. So he would go over and try to talk and chat to young girls. And obviously, the parents were not happy with that. So, for his safety and our safety, we had to make sure we had to have, someone go out. And if we were going to go to a park to say have a walk, we'd have to have someone go out and check and make sure there weren't little kids around. Because if there were, we would have to go to a different area. But Tanner wasn't at the level where he needed people to, because he thought he was 6. Tanner knows he's not 6.
When he shouldn't, blurting things out, all of those things, it's almost as if I'm talking to a big man who is 6 years old.
Dr. Barnes, you mentioned socialization. What do we mean by socialization?
Well, we all learned about values and morals from our teachers, from our parents, sometimes from like Sesame Street, from various different places. So
What? So now Tickle Me Effin' Elmo let Tanner down. Now it's Sesame Street's fault. I mean, why don't we go ahead and indict the Rugrats while we're at it?
the way that you learn about the values of society is 2 ways. One is by direct guidance, like it's important to go to church. Okay, that's an important part because you were brought here by God, and we need to respect God. That's verbally stated. But then there's what we call vicarious learning. You learn by example. So you learn when your grandmother goes to church and says, "That was a great sermon. I feel so much better." And you're listening. You're saying, "You know what? This has some value, and my family's values are that we need to respect something higher than this." Okay, whatever religion you want to be, they were good Christians. So whatever you choose to be, but you learn by guidance and you learn by watching, and that is part of development. Now for Tanner, I believe that underneath all of the problems here and this terrible crime, he did learn some things from his grandmother and even from Melissa. Melissa feels terrible about what she did, and she's able to express that.
Well, I'm so glad everyone feels terrible. That'll bring Athena back, right? Oh, great. So we're gonna take the terrible feelings, right? And we're gonna go exchange those for Athena to be back, right? Holy goodness God. Tiny baby Jesus, help me get through this last little bit of the defense without losing my sanity.
And she was able to express love to him even in her worst, darkest hours. And I've seen her worst, darkest hours, and they're bad. She understands the importance of family. Jackie did everything possible to have a family with really limited resources. Not a lot of education, not a lot of money for sure. She had to deal with Bill. That was not an easy task because he was against things that she tried to do for Tanner. But what he learned is love. He did learn the importance of certain things that make us human. And he learned that.
And he learned that and he took it away from another family, but just because he wanted to. So he knows what family is. He knows what love is. And even a 6-year-old, Again, through that sort of self-interpretation of feelings, of empathy, a 6-year-old can think, "Gosh, if I do this to it my if someone did this to me, that would really hurt my feelings." So even a 6-year-old can ponder the vagaries of morality more than Tanner is what you're telling me.
Because despite all of their problems, there still was that sense of that in the family. And even with Bill, Bill is a tunnel rat. He's a Vietnam, was, and may his, memory be blessed, but he was, fought for our country. And he took in Tanner, and it was not done with hatred. He did what he could do, but I believe that they tried their best to have a family. And I believe that in the long run, years later, Tanner wanted and wants the same thing, that he wanted to have a family, even though he had a very dysfunctional partner and very limited abilities cognitively, not intellectually, not in terms of smartness, but in terms of this pervasive developmental disorder. So those are the values that you get that you carry on.
You mentioned guidance and modeling. What happens if you don't get proper role models, proper guidance,
Well,
proper modeling?
You get it from somewhere. In middle school, you get a lot from your friends. I mean, we all know that middle school is hell, okay? I mean, I don't think I need to tell anybody that, but those years are very, very difficult in terms of developing who you are and understanding who you are. And then we'll talk about that probably sometime about identity. But you get it from other places. Now for Tanner, he started learning things through channels that were not appropriate. He got into heavy metal music. He got into
Oh my god, we're gonna blame Metallica? I'm fully on it. Where is Lars? Someone get that mother effer Lars. Forget Napster. You done did this, apparently. Apparently, we're getting Metallica. Are we gonna get Slash? Are we gonna get Axl Rose? No, Axl Rose is rock, not. Let me see. Are we gonna get Kiss? Are we gonna get Alice Cooper in here? Are you kidding me? We have gone back to the or the late 1990s and Tipper Gore? Really? With warning labels? Oh, for God's sake.
a fantasy life of superheroes, of all of these things that were avoidant, which is so typical for autism, is you go into a fantasy world. And so I think that Tanner developed values that were not his parents' values and were not necessarily the best values because of the environment that he put himself in. Because he was socially limited, he wasn't going to be a typical person's best friend. They didn't want him as a best friend. And he needed to find some way to understand the world. And I don't believe he did that in the most pro-social, adequate way. But that is part of his impairment.
Dr. Baums, you had talked about Tanner's mother and his grandmother. Did you hear the testimony of his grandmother?
Yes, I did.
Did you interview her on your own?
Yes, I did.
When she was here to testify, was she able to tell the whole story about how Tanner was raised and about her life?
No, she did not.
Why do you think that is?
I think because his grandmother has a great deal of regret and shame. I think that she has shame because she was sexually abused as a child and has always felt inadequate and dirty and not good about herself. And it's taken her years of prayer and counseling to try to get over this. She feels terrible that her daughter became a drug addict, a real drug addict, and that she could not do anything to stop that. And she feels inadequate because she did not give Tanner and could not give him what he needed. She did not want to talk about what she went through with her daughter. It's incredibly embarrassing to sit here in front of a court and state that I was a failure as a mother, that my daughter really is markedly dysfunctional. It's hard, it's shameful. And she's a sensitive woman who.
Well, I'm so sorry that you, the defendant's family, decided to get up to defend your child. Because I'm sure the parents were ashamed because there have been a lot of things heaped on to Athena's family. Remember, there were a lot of people, because I was looking at the reporting earlier, where there were bashing Athena's family. Well, those dirty hillbillies didn't know where that daughter was, probably because it was a deal gone wrong. Yeah, yeah. So how about I don't give a rat's ass about what the the defendant's family finds shameful. They were living in a house with dog feces on the floor. I, I don't know where I don't know where any pride would come from.
Really has love in her heart for her child and for her grandchild, and she's disabled and she's in a wheelchair. And I think this, in my view, having spent hours with her, this was probably the hardest thing she's ever done.
Do you believe that Jackie possessed the desire in her heart to do everything that she could for her grandson?
Without a doubt.
Did she possess the ability to do those things?
Very limited.
And what do you feel hampered her ability to give the stability or predictability that was necessary in the home?
Well, first of all, she had a lot on her hands. She had Melissa, the mom, in and out of the house with drug problems. She was trying to give her money. She had no money of her, little money of her own, Social Security, whatever. There were always financial problems. Her husband, Bill, was not supportive. And she is not a highly sophisticated woman. She's a fairly kind, I like Jackie, you can't help but like her, but she's not a sophisticated woman. And when they got in-home help for his autism, she took it very concretely. I spoke to Jackie. She's very concrete. She doesn't see the bigger picture of what the problems are from a neurological or developmental perspective certainly with Tanner. She just didn't have the tools. This is a woman who worked at Albertsons. She was a barber. She goes to church. She's not somebody who is well-versed in child development. And she's had a very, very hard road to get her to where she was when Tanner came into her house.
You had mentioned also that some of the socialization happens in school.
That's correct.
How does that impact the development of a child?
Well, Tanner, one, develops a sense of confidence and confidence.
We can do that. I mean, we are not missing anything important at this point. So, puppy kitten break.
When the world feels like a dumpster dive and humans forget how to thrive, take a break, just you and me, with a puppy and kitten, wild and free. Paws and purrs, let's drift away to a land where tails wag and play. No more noise, just gentle muse in our furry four-legged cruise.
There's also this Ivy Tower sort of look down. She tried her best, but she was a rube. There are many, many families who probably mirror the exact circumstances that Tanner found himself in, and they don't go on to destroy other families. So I'm really going to need to explain how society, how lack of hugs, how bullying caused him uniquely to do this. Because the answer is that Tanner decided to do this. And I know that's the thing that all of their experts are avoiding, but he had a choice. He had free will, and he did this.
Themselves when their peers care about them and when they feel that they fit in. And Tanner has told me in many different ways that starting early on that he's an alien. I don't mean a real alien. This is not a psychotic delusion. I mean an alien that he is somehow in this world but does not have the skills that, in quotes, humans have. In his own fantasy way, he sees himself sort of like a robot when he was a little kid, like a robot in school trying to be a human being, which is, if I were
Holy crap. Okay, this is the only thing I legitimately have always felt like I was left behind, in an alien scouting group, somewhat like ET. That being said, I am not, and they don't make sense. Oh, I should be back, and not roboted, but if I am, let me know, because I can't tell when it blinks if I'm not popping out. It's freezing this time. So we seem to be doing something brightish. I know I was frozen, but it's not kicking me out. So maybe the incognito window is working. It's just freezing me now. This woman.
write a book about autism should be the title of the book, because people who have these disabilities have to mimic, they have to cover, they don't know how to do these things on their own. And so, of course, he was bullied. He was painfully bullied. And he never wanted to tell his grandmother much about it because he was embarrassed.
Yes, middle school is terrible when you are, trying to figure out who you are, and you realize that humans are quite confusing, and you tend to take a 70,000 foot objective level look at human behavior as a 9-year-old. It's just, you are going to feel like an alien.
But he was bullied terribly through school. So you have somebody with autism, and you have someone who's on the fetal alcohol spectrum, who really cannot mimic the, everyone's talking about theory of mind, but to understand how he should act, how people perceive him. Tanner even now doesn't understand how people perceive him, how the guards in the jail perceive him, how I perceive him. I don't think he even knows how his lawyers perceive him. So what we have here is a child who developmentally, when we talk about mastering the environment and feeling good about himself, is that he never was part of things socially. And when you're not part of things socially, you don't learn the things about interaction and socialization that your peers are learning because you're not in that group. You're in your own little group.
How much social interaction does it take? Again, Tanner, by his own admission and other witnesses, went to church. The 10 commandments are fairly concrete. They're not abstract. You don't need to, sit and ponder on them. They're kind of yes, no, kind of don't do this kind of things. Do this, honor thy mother and father. Don't do this, i.e., murder. Those are concrete. Those are simple. Those are, legalistic sort of terms that you would think that someone who has autism, who's very into regulations, into very concrete and stratified things that enjoy hierarchy and limits and rules and regulations, you'd think that thou now shalt not kill thing would be like an easy thing to take in.
So when we're talking about socialization and the mastery of the environment, would interventions have assisted him in going through these stages?
Absolutely. Absolutely.
Even if he had received interventions through all of these stages, would he still have brain impairment?
Of course.
Would they still be pervasive?
Yes.
Would he still need guidance?
Throughout his life.
So how do you reconcile all of this with the fact that he had a job? He knew how to drive a car. He had friends. He went out to the clubs. He had a life. How do you reconcile the need for guidance and the need for interventions with all of the strengths that he has in his life?
Well, we've not talked about this before, so I'd like to just give an example, okay? And then we can talk. I want to tell you, prior to coming to court here, I was hit by the postal man who rear-ended my car. Okay, so nobody was hurt. He got out of the car, and he clearly was neurodivergent. He was twitching. He was crying. He said he looked at the floor and he has a hard time paying attention. He told this to me. I'm a police officer. So what we have there is a Tanner. Okay, we have somebody who has a job. He's a contract postal delivery person, kind of like a contract FedEx person.
Background checks on all these MFers win. Holy Fazoli.
And he is begging. He's like, don't fire me, don't fire me. He's a grown man, and he's crying. And then his supervisor comes. They come to where the accident was, and they're like, well, we're going to write you up, and this and that. And he's twitching and twitching and crying and crying. And it's obviously that he is neurodivergent in some way. Now, he has a job, but he looked at the floor instead of looking at the road and hit my car and did $9,000 worth of damage. And so what we have here is someone who on the surface you can say, well, you're a contract person for the post office. In reality, he is barely able to have the attentional skills to do his job. So when you do an evaluation of someone, you never just say, what is your job? Or what's going on in your family? Or anything like that. Or what are your hobbies? So you can say to somebody, I have a job doing X, Y, or Z. But to understand their impairments as well as their strengths, you need to have functional details. And by functional details is not just do you have a job, but what are your daily routines? How do you master challenges? What do you do about stress? What happens if you have to make a decision about a FedEx route or how you stack dishes? How do you make these decisions? So you could be working as a dishwasher and the dishes are piling up. You have to make an independent decision about how to stack them so they don't fall down. Do you have the problem-solving skills to do that? You can say on paper, I wash dishes at Olive Garden or wherever, at Outback or whatever. I know he worked at Outback. But can you really stand the stresses? Can you maintain a pace? Do you have processing speed? Tanner has very low processing speed. Things that would be decisions for us that happen rapidly come very slowly to him. So when you're looking at functional analysis of somebody, you don't just take things face value, I have a job. You have to, Ms. Anderson, really understand what that entails.
Do you believe that Tanner would have benefited from the early interventions?
Yes, for many reasons.
Such as?
Well, he has a normal IQ. I think that Tanner, even as a little boy, wanted to have interactions with others. He couldn't have good interactions, but I think he wanted that. And if he had found the right therapist, the right social group, like a training group, a therapy group for kids with neurodevelopmental differences, if he had been taught some basic skills, that would have helped him, like how to play t-ball or how to be successful at something or how to do artwork or whatever that may be, we would find that he would feel more confident, that he would start to modulate his behavior. And as you said, Ms. Anderson, it's not going to take away what happened in utero. We're not going to fix someone's brain. This is not brain surgery. This is using every talent, every ability that this young man may have had, and also teaching him to overcome what he doesn't have.
I want to go back to this postal worker that had the rear end, or had the car accident with you.
Yes.
You said that it was obvious that he was neurodivergent, said that he was having these switches and whatnot. He didn't kidnap you, did he?
No, he did not.
Obviously, he didn't murder you.
No.
So I guess my question is, do all people with neurodivergent disorders respond to stimulation or overstimulation or situations the same?
No, they don't. But they do respond with certain stress reactions. We do know from purely a neurological basis that people who have autism or are neurodivergent with FASD or whatever else, that their ability to plan, and they're always getting themselves digging their hole deeper. The way that I used to talk to people in counseling is you're digging a deeper hole. It's one thing or another. I had a very brighter than Tanner, college and graduate student as a patient. And he would dig himself into holes continually. So he'd do a PowerPoint, and obviously he has poor communication skills, and he's very, in quotes, nerdy, and it didn't go well. And so what he then does, he storms and he leaves the classroom without anyone asking him a question. So then he gets in trouble with the dean, and then he doesn't agree with what the dean tells him. So he goes to the president of the university. This thing is just digging a bigger hole. He should have just not been so hyper-focused on his behavior and what happened and his stress level and found other ways to cope. But there could be a lot of ways of doing that. But so what we find is the behavioral patterns. Not every situation, Ms. Anderson, is the same, but the reactions tend to have a diagnostic and commonality to them depending on the situation.
What do you mean by diagnostic and commonality?
Well, we know that the brain, all of our brains work in a certain way. We all have to solve problems by looking around the environment, pulling together information, and then our emotional part of our brain has to have some control over the thinking part of our brain and vice versa to come out with solutions. When you have damaged those areas, that's going to be very different and difficult. And we know from research and we know from clinical experience that people with these disorders who deal with stress generally do not have good reactions. It's avoidance. Tanner has a lot of avoidance. It's meltdowns, which Tanner has had many meltdowns. My mailman was having a meltdown. These are predictable things. So not everyone's going to respond to the same situation in the same way, but the impairments are generally the same.
Dr. Brahms, when you were talking about mastering the environment, you used the phrase competent and confidence.
Yes, ma'am.
What did you mean by competent and confidence?
Well, in order to be successful in this world, you have some competencies. And to have competencies, you have to be able to follow through on things, pay attention, solve simple problems, not get discombobulated by stress. All those things and many more are part of having this type of disorder and impairment that Tanner has. And if you don't feel that you're able to master the environment as a child or as an adult, Tanner could not master the world as an adult. He couldn't find the right place to live. He couldn't handle a job. He couldn't handle relationships. Then
what are we supposed to do with people like Tanner? Because it seems like the world isn't set up for them. And, not that anyone else is acting violently, but still, again, if people like Tanner are unable to fit successfully and mentally into our world, what should we do? Should we make communities with, high level functioning people where they're somewhat monitored and they can get the specialized care that they need? Do we need to build facilities in hospitals? Asylums or mental health facilities don't have to be what they were in the 70s. But if we are having a large group of people that are having hard time and are perpetually dealing with these sort of setbacks, not Tanner, but other people, what should we do for them?
feeling confidence about yourself is minimal, if not less than minimal. And you start doing things to make yourself feel better, whether it is fantasy or thinking you're someone you're not or hoping you are, whatever that is, it's not a fully formed, competent and confident individual.
How can trauma affect a person's ability to master their environment?
Well, trauma takes away from everyone's ability. I'd like to use Jackie as an example. I mean, his grandmother has had a lifetime of trauma, and her ability to focus and to think things through, she struggles every single day to do that because of the trauma that she's been through. Now, trauma can have both a behavioral impact because of your experiences. So someone is traumatized, they act out in certain ways, or they become depressed, or whatever that may be. It's somewhat more damaging though, because trauma also causes changes in brain function and brain structure. We know that toxic stress, abandonment, which he's had a lot of abandonment, seeing things that no child should see, that type of thing, all of that impacts not just the way a child responds, but the way their brain responds, and the actual neurochemical changes in their brain and structural changes because of that stress.
You mentioned the term toxic stress. What does that mean?
Well, toxic stress, there's good stress and there's bad stress. So all children grow through stress. All of us grow through stress. So if we have a problem at work and we resolve it, we've learned a lot, we've grown, we're stronger, we're less afraid to make a mistake, we've figured it out, okay? That is a level of stress that we can tolerate, okay? Toxic stress is when we do not have the tools to overcome a stressful or challenging situation. It might be two things. One, it might be that the situation really is insurmountable. There are situations that cause anybody toxic stress, no matter how smart we are, no matter how our brains operate. But stress can become toxic when that person has an impaired brain, and then they're faced with challenges that you or I might be able to deal with, but they cannot. And that becomes toxic, especially when they're faced with those stresses over and over and over again. For Tanner, it was never knowing where his mother was, never knowing if she was alive or dead. It wasn't toxic stress like being beaten every day, okay? It was toxic stress that this world is unpredictable, and this world is something that I cannot control or master every single day, and he doesn't have the skills that we do.
We're talking about trauma here. Did Tanner share with you some of the more traumatic events in his life?
Yes.
Oh, for goodness gracious sake, if we are going to go into prepare yourself, and only in this trial has this come out, but Tanner has alleged that he was SA'd as a child. So just be mindful that they might be getting into that. Um, Again, the fact that if this is true, he knew what a victim feels like and still decided to victimize again. I have no sympathy.
Yes, he did.
Let's talk about that. Did he share with you about the time that he himself had been sexually assaulted?
Yes, he did.
What happened?
Well, not surprisingly, it was difficult for Tanner to talk about. What happened is that his mother, they were living on a property that had several homes, and there was a landlord. And as I think I mentioned earlier in my testimony, he was involved in setting a fire and causing some problems on that land, and he had to apologize to the landlord. And his mother, despite her difficulties, had him apologize, and he was sexually assaulted by that landlord at that point in time.
How old was he at the time?
He was about 10.
You talked about setting fires. Were those fires, or let me rephrase that, was there any indication that those fires were set with the intent to burn down a house or to cause mass destruction or anything like that?
No, not at all.
Now, I do think the defense is trying to get ahead of these fires. Fire setting, need for attention, and a lot of these things could be indications of antisocial personality disorder or some of the darker sort of personality disorders that I'm sure the state is going to get into. I'm sure in true defense fashion, there are probably going to be multiple fires that he tried to start, which clinically I think would be something important to investigate, not just to assume that Tanner was doing it to get his mom's attention. If there was a pattern of fire starting, that might be something different clinically other than, I'm trying to get attention.
When he told you the story about the fires, what did you make of the fires?
I felt that I was talking to a young man who was unable to predict cause and effect, and he thought it would be interesting to see what it looked like if some dry brush was burning, and it never occurred to him that could spread.
When someone who has been sexually assaulted like Tanner was at such a young age, can that cause that person to either to mimic that same behavior?
Well, I don't think that the research, again, Ms. Anderson, I know you're not a psychologist, but it's not a matter of mimicking behavior. It's a matter of.
Are they going to say that it was against his will, that he was reenacting his own trauma? Because I swear to goodness, defense, you could not be more gross.
of having, when someone is sexually assaulted, there's a lot of questions raised in that person about their sexual competence, about why they were picked upon to be abused. And because of this, not everybody by far, they get into situations where they're exploring their sexuality and where they're trying to get some issues worked out about that. So I think what sexual abuse does primarily is put somebody in a position where they're unsure of their own sexuality, which can lead to many, many different outcomes. Okay, it can lead to sexual exploration. It can lead to depression. It certainly did for Tanner. He had some traumatic symptoms after that. Even now, it's in his memory. I would not diagnose him with PTSD, but I would say that at the time he had many trauma symptoms that sort of have remediated over time. But the actual event is something that he clearly does not get out of his mind. That is something that is still very troubling to him today.
And difficult to talk about?
Very.
Then I hope it visits him every minute, every second of a day, because you, sir, knew how it felt to be a victim and decided to go ahead and be a monster anyway. So, really, I hope it bothers you daily. I hope you can't sleep, sir.
You had mentioned earlier about identity.
Yes.
Tell us about that stage of development.
Well, during those middle school years and beyond, one has to establish who you are as a person. What am I? Am I a smart person? Am I good at certain things? What am I going to be when I grow up, so to speak? Much more than I want to be a fireman. We're not talking about a 6-year-old. We're talking about forming an identity that will lead into adulthood. So when Tanner was in those stages, most children in healthy situations have positive experiences. They're not bullied. They don't have home life problems. And they're able to have experiences that mold who they would be. For Tanner, he did not have those positive experiences. His identity started being formed as that alien, that person that can't really get along, who has to mimic, who doesn't really understand the social world around him. And when he started to develop an identity, what was left for him? I mean, what really was left for Tanner? Well, it was the odd things. It was the outlier things.
Oh my gosh, she's just okay. I didn't have a great home life. My mom and I didn't get along. I was bullied mercilessly in middle school. And I often hoped, prayed, in fact, that my family, my real alien family, was coming back from Ziftor to rescue me from these weird people that I got stuck with. But notice I went on to have 6 children, so that whole peopling thing I kind of got over. But yeah, how dare you, ma'am? Tanner had every opportunity. Again, there's a point in life where you stop blaming your childhood, you pick yourself up, and you make yourself into the person you want to be, regardless of what happened to you in the past.
It was the rock music and the heavy metal many people don't listen to. It was watching Marvel movies 20 times. It was Dragon Ball Z, a cartoon that I still can't understand.
I will agree that watching the Marvel movies, especially MCU, would probably give you mental handicaps. That's the only thing I'll agree with her.
By the way, but but it was all these things that created his own identity. But it wasn't an identity that was the typical identity of I'm in 4-H, I'm in the school play, I play basketball, I do these things. At that point, he was a church-going kid. And he could not sustain that. Now, I know later on he's become much more serious about the values his grandmother taught him about religion. But at that point in time, he couldn't get along with the youth group there. I mean, I think he played some kind of musical instrument, but he shared. He's always an outsider. So he went to activities that made him comfortable because he found people like himself.
How would a person who has level 1 autism, how would that impact their ability to navigate this developmental stage?
It would be very difficult. I think having, I really don't like talking so much diagnostically. Level 1 autism, to me, is worse than more serious autism. Because, and I know that sounds probably off the wall here, but I do mean that to some degree as a professional. Because if you are more impaired, people see that you're impaired, and people either have empathy or you get special services or whatever. But it's the people in level 1 that are the ones that are hidden figures. Nobody sees they see the superficial. They see someone who has a job or
Okay, this is the reality for anyone with a hidden disability. No one, if you looked at me, if I didn't have my walker, if I wasn't having a bad day, you wouldn't know anything was wrong with me. I don't tend to, park in the handicap parking spots because I know that in the long run, mobility for me is going to be just walking. It's, keeping those skills, not letting my legs atrophy. You wouldn't notice. I'll stand on one leg. I don't look around and tell people, "Oh, by the way, I have this really weird nerve thing. You might have heard of it." No, No, because most people don't care. Most people aren't paying attention to me, which is why I got over limping in public. But welcome to the world of having a hidden disability. It's like that for everyone who has a hidden disability. You know what we don't do? We don't usually kidnap a young girl. We don't do that. So millions of us are able to operate our self-control to the, ability that we are able, and we don't do this.
This or that, and goes to school and graduates high school. Not greatly. I think he was like 350 out of 355 or something, but he graduated. Okay. And so what the issue here is for Tanner is that he didn't stick out. He stuck out as odd, but in terms of the services that he needed, like in high school, he had minimal services because people did not understand the depths of his impairment. They saw a kind of pain in the butt, goofy guy who was attached to school, who had his social issues, but nobody really understood the limitations that he encountered every day.
So it sounds like when we're talking about level one, people tend to focus on the strengths and not the deficits.
Or they just don't see the deficits, or they see these youngsters, teenagers, adults too, as just odd or sort of bothersome or not really doing the job they should do. But I don't think that it comes out as a impairment to the degree that it really is like to have level one autism. That is a pervasive developmental disorder, regardless of what clinical level we put it at. I don't care if you give him level 2 or 3 or 100. Tanner is Tanner. Tanner has these impairments, and he has struggled with them without very much help. I mean, he had Ms. Weaver, who's a lovely person, but the type of intense, continual intervention that he needed till adulthood and through, he did not have.
You had talked about his feelings and that he was gravitating towards outlier things.
Yes, he did, for sure.
So when someone sees themselves as an outsider or someone who just doesn't fit in, can their own, self-identity impact how others, it's a self-fulfilling prophecy, I guess.
It is. It's a self-fulfilling prophecy. I mean, Tanner was, I'm going to say this, less capable than his peers that he chose. He chose outliers. He had 2 friends that I talked to who were punk rock, used drugs. They finally had a life and they have a couple children and they're very nice people. To this day, they look at Tanner as as they put it, their disabled little brother. They know that he doesn't have the judgment, that he doesn't have the social skills. So what we have here is Tanner went to a group of people, especially his bandmates, who were into all of this fantasy and all of this stuff. And even then, he told me he was kicked out of 10 bands. He doesn't know why he was kicked out. He has no idea how inappropriately he was from a social perspective. He told me some of the things he did. And they weren't dangerous. They were rude. They were comments he should not have made. They were things he did that were remarkably immature. And even those guys who were in that outlier group thought he was more of an outlier.
So how would having someone in the home to help form this identity affect their ability to form that identity?
Say that again more clearly, if you don't mind.
I don't know if I can.
Okay.
I'll try to get that.
I believe that there is another one of his bandmates that is implicated on some of the charges with the 2 underage victims in this case that testified that are having their cases move through the court system right now. I do believe that there were allegations with one of the victims that another band member was involved. So I am not sure, but it does seem like, and the way she's saying outliers and stuff, I don't know.
How important is it for a child to have someone to encourage them in the home being?
Well, when you talk about adulthood and you talk about going into adulthood, you need to have the resources to become an adult. And I think that's kind of what you're getting at, in a way. Yes, I think you're talking about what do you need to become an adult? Well, first of all, you need to have a brain that functions well, because adulthood has complicated challenges, really complex challenges. Whether you go to college, whether you get a job, you have to have the ability to plan, to problem solve, to pay attention, to deal with stress, to control yourself behaviorally, not have meltdowns, all of that. But then you need to have a home that gives you some type of support and guidance. It doesn't matter, Ms. Anderson, if they're rich or poor. I have families that are not wealthy at all, and that their son or daughter knows that if they need $20 for gas, you can go to mom. They also know if they're having a problem with a girlfriend, they can go to mom or dad. And as you have that support, you're slowly able to start to acquire those adult skills and independence, that adult independence that we all need. But you can't just go from being a teenager like he was with these pervasive impairments, and all of a sudden he's in the adult world. There was like no transition for him, and he did not have the resources in his home or his cognitive neurological resources to really function as an adult. And I think we all see this over the testimony that's been given.
When we talk about adulthood and independence, I've heard the phrase fully integrated. What does it mean to be fully integrated?
It means that a person is able to accept their positive and negatives, that they're able to see themselves as a complex person, and they do not have to shut off certain parts of themselves. So if I make a mistake, and we all make lots of mistakes, if I do something that, let's say, is rude to Miss Anderson, okay, I wouldn't do that, but let's say I did. I made a comment I shouldn't make or whatever. That is still part of me, and I can analyze that that is it. I was either stressed, or there was something in my childhood that you reminded me of that I got upset about, or I was just in a bad mood. But I also can take it, I can also understand that I don't have to kick that apart and say, oh, that's just somebody else doing that. That's not really who I am. Of course it's who I am. It is who I am. I did it. I said those things. But when you're fully integrated, you're able to understand and accept and pull together all parts of yourself. And
Wait, didn't Neo tell us not to fully integrate? I mean, let's be real. This timeline, the Matrix is mixed up. Can we unintegrate? Can we reset the Matrix?
that's a challenge. That is a developmental challenge, and it takes time to do, and some people never get to that point.
Was Tanner ever able to get to that point?
No, he was not.
How important is it to have coping skills in order to help yourself to fully integrate?
Well, the coping skills mean that if you do something wrong, like if I was insulting to you, I'm not going to not deny it. I'm not going to make up untruths, fanciful untruths that, for instance, like, I was in Uber going to court and the guy really scared me. And then I saw somebody who I didn't like. And then I was in the elevator and I got stuck. And that's why I'm in a bad mood. These are fanciful things. It's not true. The reality is I was wrong to talk to you the way that I did. And I'm able to accept that as part of myself. But when you are on, either have signs of FASD, where many people on the spectrum have a very hard time just coming to grips with what is going on in the here and now, as well as autism with the theory of mind issues, these are difficult things to do. So Tanner has a double, if not triple whammy. He's got difficulties in his neurological functioning from FASD and from autism, but he also has a family, as good-hearted as they may have tried to be, who just were unable to give him that type of guidance and daily reinforcement about how to function.
You mentioned earlier about avoidance. Is that how Tanner copes with things?
That is Tanner's main way of coping, is he avoids. He avoids through music.
So he could have avoided Athena because he didn't seem to avoid her. He went out of his way to pick her up. So how in the hell does avoidance come on into this other than he's trying to avoid responsibility? He seems to be great. In fact, generationally on both sides, the family seems to be great at avoiding responsibility or accountability for anything.
When he's stressed, he plays music. He avoids through watching the same Marvel movie 20 times. He avoids by watching Dragon Ball Z 100 times. He avoids by smoking weed. He avoids in a lot of ways. He avoids, and it doesn't work because he's still anxious and he's still depressed.
So how does he cope with changes?
He doesn't.
How does he cope with stressors?
He doesn't.
How does he cope with disagreements?
Not well. He leaves. He's not an arguer. He can't do the social. He can argue, but it's ineffectual.
How does he cope with adult responsibilities?
Very poorly.
And
So you're saying he can't cope with adult responsibilities. He can't cope with confrontation, but somehow he didn't avoid the confrontation with a little girl. So maybe what you should say is that he can't cope with adult confrontation. He hasn't been mean to any of the guards because he's a coward. But he sure as hell could exercise dominance, control, and didn't avoid confrontation with Athena. JKD Buck, she is maligning us. She is maligning us. And again, I've had one of those comfortable moments and the uncomfortable moments in this trial where I'm like, I resemble that remark because legitimately I did survive middle school thinking I was an alien and my family were coming back to get me back to Ziftor or whatever planet name. But yeah, it's really hard to have someone take things that you do kind of naturally in your own normal oddity and then say these are things and excuses for this man doing heinous things.
is he able to manage multiple demands?
That multiple demands for anyone with his limitations are difficult, but for Tanner, they are really destructive. When he has multiple demands, especially in stressful situations.
Multiple demands, ma'am, like, please don't hurt me. Please just let me go home. I'm sorry. Oh, I'm gonna go take a restroom break. Otherwise, I'm going to start cursing.
Like not having money, not having a car, having to go places, having to work. He completely melts down. It might not be crying, although I will tell you, as an adult, he's banged his head many times. He's self-destructive. He hits himself. He does things with a lot of self-hatred, a lot of meltdowns, all of this. But no, he does not handle complex situations, multiple demands, stress in any way comparable to a regular adult.
When we're talking about the avoidance, you mentioned that he avoided by going to music.
That was a major way that he coped, yes.
So how do we, again, reconcile the type of music that he has, that he loves, the screamo and the heavy metal and
Yes.
whatnot, with the fact that so many people with autism have issues with noise?
Yes, but for Tanner, this music, which I made myself somewhat familiar with, is noise, but it's really for him white noise. Children on this, adults too, who have these disorders do very well in environments where like a fan is whirring or there's these white noise machines. Many of my clients, the parents would buy them these white noise machines where it just blocks out other sounds. But for Tanner, he knows the lyrics of every song. He has that control. He likes the loudness. It sorts out, it sort of avoids the thoughts in his head. He completely goes into the music. And for him, it's calming more than overstimulating.
Let's talk about the interrogations.
Okay.
Did you see all of the interrogation videos?
Yes, ma'am, I did.
Now, from a clinical point of view, what were your impressions of these interrogation videos?
From a purely clinical point of view, Ms. Anderson, if I was not involved in this case and someone just clinically gave me this then and said, what would you think about that person? If I knew nothing except the video, okay, and this was a test of some kind, I would definitely say that person was on the autism spectrum, without a doubt.
Why's that?
Because he had no ability to understand what the police officers and the Texas Ranger was trying to do, how he presented to them, why the comments he made would be taken so badly. I mean, his inappropriate comments about only wanting to see his son and about Christmas, among many other comments, he had no idea how that would be taken. He didn't understand how fanciful his lies were, if you want to call them lies. They're misinformation for sure. He had no ability to reflect. You could see in him the difficulty in communicating anything but these very basic, immediate needs and not being able to see the bigger picture of what is going on in those interrogations. It's just obvious from a clinical perspective.
What about from a forensic perspective?
Well-
What were your impressions of the videos from a forensic side?
I think in his own incapable way, he was trying to not tell the truth to the officers, but he admitted what happened to Athena. He did say that he was responsible for her death. He did say that. But then he tries to either delay what's going to be inevitable, try to come up with some type of excuse or something about what happened. I mean, you have someone here who's just incapable. This was not a criminally minded lying. This was some type of ineffective storytelling that anybody who would interview him would know would not be true.
How is this not a manipulation?
Yeah.
It's a sign of autism. It's a sign of what he has on. What is he manipulating? He admitted what he did. Eventually, I hate to talk about this, it's very painful to talk about, but they eventually found Athena's body. Eventually, he got them into the area. What is he getting from that manipulation? What is he gaining? He's gaining nothing. There's nothing to gain. My question watching the interrogation was, is this a fantasy? Is this him trying to be on Law and Order? Is this Tanner's just way that you're supposed to talk to the law enforcement like this? It seemed almost like he was movie scripting, like this was something that if you're caught, this is how you act. But it had no end. There was no purpose to what he was doing.
So when you're talking about manipulation, generally does a manipulation have a purpose to the end?
It has gain generally at the end, whatever you're manipulating for.
And in this particular case, there was no gain at the end?
I didn't see any gain at the end. What I saw was someone struggling to make sense about what happened and struggling to understand, which he did not, what is going to happen to him. To him, at that point, it was just let me go home and see my son.
Again, no, I'm sorry. He thought this out. He thought he was wheeling and dealing. This isn't a man who is intellectually subnormal. In fact, he is on, the normative spectrum, the normative deviation for IQ. He has the IQ to understand that he was not going to get out of prison to go see his son. He knew that 0 was BS. He enjoyed having power over those cops. You can't tell me differently. And it will be really interesting to see what the state's experts say, because every single one of the defense's experts have claimed that the manipulation in the interrogation was all due to autism, not any sort of real choice that he made. Again,
I don't think that he understood the gravity of what was going on or how the police and law enforcement, those Texas Rangers, would perceive him.
During your evaluation, did you discuss these interrogations with Tanner?
To some degree, yes.
And what was his reaction when you started challenging him on these interrogations?
He went back to the fact that nobody understood how much it was Christmas and he wanted to see his child. He told me that he did not really remember everything that happened. He told me basically he did not understand the gravity of the situation.
In these videos, we see Tanner take on the persona of Zero.
I know.
Does taking on this persona
did that annoy the ever living crap out of you? Because that was the dumbest thing ever. And don't tell me again, he is normal IQ. You're telling me that even with processing speed, a computer, doesn't, it takes longer, but it still understands eventually.
make any sense to you?
It makes diagnostic sense, absolutely.
Why is that?
Of course,
Because you see this in a lot of people like Tanner, that's the lack of integration, the lack of integration. He cannot say, I did this. He said it happened, okay? He said Zero was involved in this, Zero, okay? Is there really a Zero? I don't think that there's a Zero that walks around with him all the time. Is it something that he has a Zero in his life that he turns to when things get bad, that he talks to, that's sort of a part of him that's not integrated? Yes. And I think in this very stressful situation, when you have to talk about something that is so horrendous, I believe that this was his autistic way of being able to talk to law enforcement. That Tanner Horner himself is not integrated. Tanner could not do this. He had to put some of this aside. I don't think that this is a fantasy. I think this is the same thing as when your 4-year-old breaks something and you ask them if they broke it, they have an imaginary friend or say somebody else did that.
Oh, no, hell no. Keep my youngest, most feral, who is able to lie on his own cognitively, out of your mouth. Don't bring other people's kids into this. No one wants their children associated with Tanner in any way. You can associate your own children, should you have had any, with Tanner if you want to, but do not associate anyone else's children with this monster, okay? Because ew.
This little guy did this. This is the developmental fixation that we have with Tanner. So, I don't think there's no such thing anymore as multiple personality. I don't think he has dissociative disorder. I don't think that he really has another person. I think you're looking at someone who is remarkably impaired and extremely immature for adulthood.
So in taking on the persona of Zero, it sounds to me that was just his way of being able to tell the police the truth.
That would be my testimony, yes.
And so how do you tell if that's just not another manipulation?
Again, I don't see in the interrogation what he would get out of the manipulation. I don't see any gain. They know that he did it. He said that he did this. I don't see that there's anything else that he would gain. You've got to understand that Tanner also takes on other persona. I mean, he sees himself as a Marvel character. He lives in these movies. He takes on other identities, not in terms of going to work and acting like he's Superman, but in terms internally fantasizing that he is some of these characters, that he could be that competent, that he could fly, he could be the superhero. And he lives in those movies. He lives in that music. He lives in another space because, as he puts it, the Tanner space is not the best space to be in.
I guess the question I have is, could that be perceived as a ploy to feign insanity?
Let me put it this way. He's never feigned insanity with me, ever. He's never said that he's had psychotic features or he sees things or hears things. There's nothing like that. He speaks about his depression very rationally. I don't see that. I did not see any feigning during the interview. I did not see him telling the officers, I have a severe mental illness. I'm mentally ill. I think that you're the devil. There's nothing like that. He is just somebody who comes across as very incompetent and unable to relate on an adult level.
Dr. Brahms, I'm going to shift gears a little bit. And I want to talk
Oh, God,
about
are you almost
antisocial
done?
Personality disorder,
Okay.
also known as ASPD.
Yes.
What is
Now, I have paid attention and they have made sure to ask every single one of their experts about antisocial personality disorder, sadomasochistic sexual deviance, or whatever they want to call it now, and then PDF file proclivities. Now, all of their experts have denied he has this, but the fact that those are the three that keep being asked about, I am guessing there is a high tendency or a high reliability on the fact that the state's expert witnesses are going to find all these three things.
Is ASPD.
Well, obviously, it's antisocial personality disorder, okay? And I don't want anyone to get it mixed up with AS, which is autism. Okay, antisocial personality disorder is a long-term, ingrained way, a maladaptive way of perceiving and interacting with the world, like all other personality disorders. Antisocial personality disorder means that the core of your character, the way you perceive the world, the way you interact with the world, is antisocial in nature. That your primary responses to situations would be to act in ways that are criminal or in some ways against the values of our society. So it has to be long-term, chronic, and it has to be really the core of who you are.
When you evaluated Tanner, did you find that he met the criteria for a diagnosis of ASPD?
No, I did not.
And why not?
Why did I not see that? Okay, number one, you have to look at differential diagnosis. Tanner has done some things that people might think are a little creepy. He's done some things that are not right. He may have been involved in some sexual other activities that may have been illegal. Never was convicted of them.
May have. No, how about he was 20 and they were 15? Not may have been illegal, was illegal.
Okay, but he does things that are impulsive and not always in his best interest or that of others. However, when he thinks about the world around him, I never saw anything that he thought about things in a criminal sense. I've dealt with criminals for over 40 years, and their attitude is always criminal. They talk about their past experiences with bravado. They talk about being so tough and, I can sell drugs on any street corner. I can do this, I'm the toughest criminal. I don't see anything like that with Tanner. I don't think that the things that he emulates are superheroes, not criminals. The movies he watches are not, criminal movies. They are fantasy movies. I don't see anything in him chronically. And I spoke to Jackie and his mother and people who knew him, his teachers. Nobody ever felt that there was a criminal attitude about Tanner.
Here's the problem. You've already said that Jackie and the mother, Melissa, were incredibly unreliable narrators, that they wouldn't give in to things, that they would withhold things, that the grandmother, Jackie, extremely limited her daughter's problems on direct.
Your opinion that Tanner does not meet the diagnostic criteria for antisocial personality disorder is based on the evaluation that you did of him?
Yes, ma'am.
Based on the interviews of, sounds about at least 6 or 7
Yes.
collateral witnesses,
Yes, ma'am.
and then the records that you reviewed,
Yes.
and the hours that you spent with Tanner.
Correct.
But she didn't test him or anything. She only looked at records. She didn't give him any diagnostic tests. So again, explain to me how he doesn't have if you didn't give him any diagnostic test, probably because he would score rather high on them and you didn't want them to come out.
And nothing in any of that would lead you to believe that he meets the diagnostic criteria for antisocial personality disorder.
That's correct.
Can the symptoms of his autism spectrum disorder, how do you determine what is autism and what is antisocial?
Well, you have to understand what it means to be autistic and understand patterns of behavior. When I said Tanner's textbook for a lot of this, he really is. So you have to look at, the fancy word is etiology. You have to look at the foundation for where certain behaviors came from. So when you look at Tanner doing certain things, you have to understand that it's from the perspective of someone that has a neurodevelopmental disorder. And you have to understand how he thinks about the world. Did he think about doing something to be a criminal act? Or is just this a behavior that he doesn't really understand how other people are perceive this as maybe inappropriate or maladaptive? So when you always have to make a differential diagnosis. So for instance, this is maybe a silly example, but years ago I was giving a lecture to some teachers and we were talking about diagnosis. And one lady raised her hand and she says, I think my husband's crazy. This is what he does. And so this is what he does. Every Saturday he gets up and he mows the lawn wearing this pair of Aggie shorts and he smokes a cigar. And he goes around and he's got no shirt on and he mows the lawn. So she goes, is there something wrong with him? So you make a differential diagnosis. Number one is that this might be just his way to relax. Number two,
I guess the Goldwater rule isn't in effect. Typically, you are not, as a professional, supposed to diagnose someone in a professional concept or in a professional way without having seen them.
Two, he just might have some oddities to his personality. Number three, you should be really happy he's doing the lawn. I mean, these are the differential diagnosis. Now, I could come on and say that it's inappropriate. He's wearing a shirt and no shirt and these stupid Aggie shorts, and he's showing off because he's a narcissist and he's a pervert and this, that, and the other. But then I ask her about him. He's a wonderful father. He's very silly. He makes stupid dad jokes. He is a stupid dad joke person. So she was just raising her hand in a teacher's workshop. But that is a differential diagnosis. You have to understand the person as a whole before you look at the behaviors and decide what the foundation of those behaviors are.
So it sounds to me what you're saying is that you don't take things at face value. You have to dig a little deeper.
Absolutely. And you would expect that if you went to a therapist. You would expect that for your family, much less for a court. It's very important to dig deeper and just not look at a symptom or a behavior as a behavior. You have to understand where that came from.
Can someone have an antisocial trait and not be diagnosed with antisocial personality disorder?
Well, all of us have antisocial traits. All of us have done some antisocial things. There's not a
We've been around people, and ma'am, your entire testimony is making me really okay with my antisocial behavior. You know what? If you are what is involved in society, I'm okay that I opted out. I'm okay that I'm an inside cat. If peopling means that I have to deal with this kind of excuses, I don't know. I'm okay being a non sort of people person.
person among us who has not anything could be considered antisocial. You know, what does that really mean? Have you ever filled your cup up at McDonald's twice and you're really supposed to get one refill? Many people have. Okay. We've all done things. Have you ever run a stop sign? I have. Okay. Have you ever done things that are probably wrong? Yes. Everybody has done things that you know are against the law. Okay. And little things or bigger things. The question is, we all can have some traits and some behaviors, but that doesn't mean that we are diagnostically antisocial. It may mean that when we're risk takers than others. I mean, somebody on the jury might never fill up their Diet Coke again. I have. I mean, okay, I have because I had to be in court and I'm in a rush and I just put some more Coke in there. Is that stealing? I guess. Although one of my clients worked for McDonald's that all their profit comes from pop. So I felt less bad. But the reality is that an antisocial attitude.
So you made a moral judgment based on information from an unreliable source, and you've decided that morally you're a good person. Do you see how subjective your entire life work is? You decided, well, legally, not good, probably shouldn't do it, but if I stick it to the corporations, okay.
Ms. Anderson, probably a little bit. But does it give you a personality disorder? No.
Well, can someone commit a crime as horrible as the one that Tanner has committed and has pled guilty to? Can someone do something that horrific and still not be antisocial?
Yes.
The last thing that I want to talk to you about is his impairments. Dr. Brahms, did Tanner's impairments cause him to commit the act to which he pled guilty?
No, but they set the stage for his life.
Are his impairments and his deficits any sort of excuse for what happened?
No, and I need to say that none of my testimony in any way should be implied as an excuse for what happened. This is only.
No, you made your entire thing. Again, this is lip service to that idea. You have just spent 2 hours saying that everything was autism and his parents and his mom. And who should we blame? Society, the fact that he wasn't. You have spent 2 hours making every excuse for this man. Well, he was really trying to, communicate his sadness through zero. And it was heavy metal's fault, and it was his friends, and it was bullying, it was middle school. So pray tell, how in the hell is it that the last 2 hours haven't been a soliloquy of excuses for this dumb fuck?
An explanation of who this defendant is so that whoever decides his fate understands him as completely as possible, but this is absolutely not an excuse.
What about a justification? Do his impairments justify the kidnapping, assaulting, and murder of a 7-year-old child?
This has nothing to do with justification. It has to do with understanding the person who's before the court and being able to weigh their strengths, their weaknesses, and their ability to be compared on a level that maybe you or I would be.
And lastly, Dr. Brahms, you spent time with Tanner in the jail.
That's correct, ma'am.
Saw him interacting with guards.
Yes.
saw him interacting with other people in the jail?
A couple, but mainly correctional officials.
Based upon your review of the records and your observations of Tanner, how well has he adjusted to life in prison?
I would say he's adjusted very well.
Wonderful. He's never leaving. Congratulations. You finally found a home. He has a home. He has a home. Let's live in there forevermore. I'm so glad that he's adjusted. Guess what you'll be getting? Jail for the rest of your life. And honestly, the defense has made me question whether I want him to go to Gen Pop because it will probably be less filled with appeals than the DP.
You have a moment, Your Honor?
Yes, ma'am.
I'll pass the witness, Your Honor.
Oh,
Cross-examination.
thank you. Give us logic.
Ma'am, how many psychologists does Tanner Horner have in this case?
I cannot hear you. I'm sorry, you're drinking water. I couldn't understand you.
How many psychologists does Tanner Horner have in this case?
As experts,
Yes.
I've never counted. I can try.
Well, he has Dr. Ryan, who you talked to, right? Is she a psychiatrist, psychologist? What is she?
She's a psychiatrist.
Okay. And you got Dr. Spence and Dr. Emhoff.
Yes, I think is more of an autism. They're both autism specialists.
Right? And then you have some other people. You have Dr. Davies, who you talked about, had the fetal alcohol thing, right?
Right. I know Dr. Davies. Yes.
And so would you agree with me? There's been a whole lot of people interview him consistently over the last several years.
That's correct, sir.
Interviewed him and asked him the same basic questions you're asking him about his family. Those things have all been asked multiple times.
In different ways, yes, and for different purposes, but yes.
And so in this particular case, let me ask you, did you review all of their reports in this particular case?
Yes, I did.
Okay. And let me ask you, where's your report?
I do not have a report
Why not?
because my testimony was going to be based upon all of the other people's reports. And that is what was agreed to by the defense, that I would wait until all reports were submitted and testify from the information I have, not just from the report.
Why the hell are we paying you $28,000? You didn't even write a damn Word document. I mean, again, if I was the state of Texas, I'd be pissed the hell off. If I'm a taxpayer, I mean, at least the other expert assholes wrote a report. This heifer didn't even open Word, double space. She could have written a 5-page dissertation on stupid of what she just said, but she didn't. Oh, hell no. I mean, again, Texas, this is on you, but you might want to see how much you guys are burning up on these capital cases, because this seems to be the defense team that's involved in a lot of the capital cases, and they are hosing the state of Texas.
But from obviously many other sources.
Okay. So I guess what I'm trying to figure out, you didn't do any testing.
No, he's been tested and tested. There was no need for me to do testing.
Okay. So part of what you're doing today is just simply repeating what other people have already said in this case.
Absolutely not.
Well, you're repeating things that you got from Dr. Ryan.
I didn't know that I was
Yes.
repeating directly from her report at all. I'm talking about Tanner's development. She's talking more about diagnostic issues, but I don't believe that I quoted a report in my testimony.
But you don't have a report that we can look at with regard to your findings and tell us that before we came in here today and you testified.
That seems to be correct, yes.
But you were able to have a 27-page CV. Interesting.
I'm just going to start from where you ended here. You said that Tanner has adjusted to jail life, correct?
That's correct, sir.
And that's because he's been in SEG the entire time, correct?
Well, it could be SEG is difficult to adjust to. Sometimes people have a lot more problems in segregation than they do in general population. So that's a difficult question to answer.
Well, being in SEG, he's had no changes because he's been in SEG.
Not any meaningful changes, not a lot. Some,
He's had structure because he's been in SEG, correct?
that's correct.
He's had a routine because he's been in SEG, correct?
Yes,
And he hasn't had at least access to any other inmates, correct?
not really,
Physical
no.
access.
No,
And the only people he would have access to would be guards that come by and interact with him at some point.
that's correct, sir.
Now, I'm trying to figure this out here a little bit here. You talked about he's got some development problems as a child. Is that right?
He has many problems with his development over the course of his trajectory of life. Yes, that's true.
First thing you said is that he he had a problem with reciprocity and attaching to others.
No, that's not what I said. What I said was the environment that he lived in and his mother's difficulty would make it difficult for him to have that stability and reciprocity. And I think that we see that in his adult development. That's what I testified to.
All right. And so because of that, that's why we've ended up here today. Is that what you're saying?
Absolutely not. I think I just testified with Ms. Anderson that I'm not saying there's a correlation between.
No, but you do understand that you just gave a 2-hour TED talk about how his messed up brain can't do anything, so Tanner shouldn't have been out on his own, and that he revisited his trauma on Athena. Again, you spent 2 hours clinically telling us that his brain don't work right. We shouldn't have him in society, basically. So what do you want us to take from that other than, again, she does not understand what she is, how it comes across. Because while she may be very right about the syntax and the terms that she used, it's very, very clear that she believes that Tanner was let down by society and we created the monster. Now, what we're supposed to do with this information, I don't know, but it's very clear that she doesn't hold Tanner accountable in the same way she would hold anyone else accountable for this crime.
What he experienced as a child and this terrible crime. What my only role here today is to try to give information, unbiased information to the jury so they can understand Tanner more fully. I've not talked anything about the causality of this terrible crime.
All right. So all the stuff that you talked about with regard to his development up and through his childhood, you're saying that didn't have anything to do with this crime?
It has to do with the jury understanding what his functioning was like at the time of the offense and what his impairment has done to him over the course of time.
All right. So let's talk about that. Did you watch the audio and the video in this case?
Of what? Of the interrogation or?
Of the murder?
Yes.
Okay. And you testified, and I'm going to try to use some of the words here, that he can't handle stress, he's impulsive, trying to remember several places here, but essentially he doesn't have the ability to cope. Am I right so far?
Generally, yes.
Okay. And
Well, to cope adequately.
cope adequately.
Yes.
So what is your belief as to what happened that precipitated him kidnapping Athena Strand? What's your belief on that?
I do not have a hypothesis. I've thought about this a lot, but that's not my job to address that.
Okay. What did Tanner tell you went on before he kidnapped Athena?
What he told me is that he believed that she saw him snorting coke and he felt that this would be detrimental to his job. That is what he shared with me.
So do you agree with Dr. Ryan that this was all some form of catastrophe and cascade of decisions because of his disability that resulted in this? Do you believe that?
Let me slow you down for a moment. Dr. Ryan did talk about catastrophizing, which is a term that's used often in autism. Do I believe that he catastrophizes or digs himself deeper in a hole? Absolutely, 100%. He's done that in relationships and jobs as a middle school student. I mean, that is Tanner. So I don't know about Dr. Ryan. I believe that her observations and her findings are correct. At least they're in agreement with what I feel independently about Tanner.
Oh, well, as long as they're in agreement and deal with my confirmation bias, then she is, of course, correct.
And so you'll agree with me that everything with regard to that theory begins with what Tanner says he saw at the time before he did. Everything begins with that. Is that right?
My job is not to talk about the offense. You asked me, does he catastrophize? I agree with Dr. Ryan. I might use.
No, he asked if the nexus for this theory, this idea, this entire story that Tanner told that she caught him doing illicit drugs came from Tanner. You're a smart woman. I know you can pay attention. Close that mouth hole, open those ear holes, and listen. Because if a twice college dropout who's neurospicy can figure out the question as it was being answered or asked, you can too.
A different word, but I totally agree that he gets himself in situations that he cannot get himself out of. Yes.
I mean, don't you think the facts of the offense in this case are the most important thing that we can talk about?
But that's not, well, it's important for you to talk about it because you're the prosecutor. My job in this is only to talk about his development, only to integrate what we know about Tanner, what we know about his disabilities, or I would like to say impairments. More, it's not really disabilities. It's a pervasive impairment. It's not to talk about the offense. That is for other experts to talk about, not for me.
But you would agree with me, you're offering it as some form of explanation as to why he did what he did.
I'm not sure you listened clearly to Ms. Anderson's questions, and I apologize if I was not clear enough. I am not offering this as an excuse or explanation for anything. I'm offering this because in a court of law, It is the jury or judge's responsibility to understand who they are sentencing and what that person's capabilities are.
Okay, well, I now know what I'm sentencing to the death penalty. I Okay, thank you, ma'am. You've done your job. I now know all the things, and I don't give a rat's rah-rah.
I am not talking about the offense. I'm not hypothesizing about the offense. What my role here is to
Oh,
present to the
yes, we are still on the defense. Now, the state rested, I think, on day 13 or 14, and we've had almost 2 weeks of the defense.
best of my ability what this man's development was like and how he ended up to be the person that he is. And that is what I was retained to do. And I hope that I've been clear as I possibly can.
Let's talk about his capabilities, since you mentioned that. In the murder video, you're aware that he had a pattern of covering up the camera immediately before, on 2 different days, before he arrived on the same exact road where he kidnapped Athena. You're aware of those facts, correct?
So again, I think that this whole illicit drug taking thing is a very convenient story that it was planted or thought up by the defense or Tanner, because it takes away that premeditated hunting of a predatory nature. But he didn't have illicit drugs on him, and we haven't heard any testimony that he tested positive for cocaine or anything else. So I think that this was a story cooked up by Tanner and the defense to take away that premeditated predatory hunting and scouting he was doing in these very rural areas as he was, delivering in the week to weeks prior.
Not in detail, but I've heard those facts, yes.
Okay. And if those facts are true, you agree with me that that's some form of pre-planning or planning before he goes and does this to Athena?
I don't know that. I never discussed that with him.
And then at the point at which you said that he has, I think you said he has problems with impulsivity and problem solving, and I think you mentioned the word meltdown. Is that right?
He's had a long history of meltdowns in various ways, ever since he's been, 2 or 3 years old.
And when you watch that video of the murder, there's no evidence of it having a meltdown at that time, is there?
Well, I do not know what was going on with him in terms of his thinking, because his meltdowns as he became older are more like the stress reactions that I testified to about before. The confusion, the not knowing how to get out of a situation, the anxiety. He has continual anxiety. So I don't know. I do not see behaviorally a meltdown, but I cannot say that he was not, in terms of his emotions and anxiety, was not having difficulties in figuring out how.
Now, the state, and we've seen this a lot with other witnesses. This is an expert witness that you are never going to get to change her mind. So the state should stop trying to argue with things. She is going to be very, very, I didn't say that, and I've never said that. I would just go with what we have and toss her back. I don't think, I think if they're watching the jury, now maybe he is prolonging this because he sees that she's getting some response from the jury. But I wouldn't cross this woman too long. You are going to have your experts come on very shortly. She seems unwilling to give you any sort of charitable view of any of your questions, and she's just argumentative. Now, if the jury is responding to that, good, but you don't want to seem like a bully. She has been relatively well spoken and kind. So it's a fine line for how aggressive they can be with her, I think. And I don't think they're gonna get a lot out of her. She seems very dedicated to her point of view. So I would cut my losses and let her go back to the defense. I mean, we don't need this woman who's listening to Roz from Monsters, Inc.
handle a situation. I don't know that.
Well, where did you see on that video of the kidnapping murder that he was confused?
Again, let me say that I did not see that he was confused. I do not know what was going on with him, but I do know that this massive reactions to stress, that his inability to get himself out of situations, that his ability to plan and to think about the best way out of things, this has gone on throughout his entire life. I mean, he ran out that steakhouse because the dishes were piled too high. That is how Tanner copes. He just cannot figure out a way to interact with people, problem solve. That's what he does. But, I do not know what happened in that truck. Nor it was my role to talk to Tanner about what happened. Whatever he volunteered, I took into consideration. But that's not my role in this hearing.
You used the example at Outback and you said the dishes were too high. You know that's not the complete truth, right?
No, it's part of the truth, yes.
Okay. So what's the whole truth?
He did not show up at work at some point. I know that. I don't have all the details about Outback, but what he did share with me was avoidance, was leaving, was quitting, was sitting there and looking at the dishes and having a panic attack, which is absolutely prototypical textbook for someone with autism. It's nothing that would be unexpected. I've had dozens of young people tell me that they've left their place of work because they're overwhelming anxiety and confusion. So what he's telling me was not something to write home about. It's very much diagnostic.
Just wasn't the truth.
I don't know what the truth was. I know that he was honest and told me he didn't show up for work. He told me he became overwhelmed.
Fair point, you guys. I'm just tired of this woman. This woman annoys me, and there's a point at which my brain is like, "You're not gonna get what you need out of this woman. Let's go to another person." But it does show that she's very obstreperous. She, willfully doesn't understand the question or takes the worst possible connotation of it. So it does show her bias as an expert. She was all kind and, "I love you, Miss Johnson." But with the state, she's much more adversarial. Now, the state started somewhat adversarial, but I enjoy what the state is doing here. If it were me, though, I would probably cut my losses because I don't find this woman particularly persuasive. But that would be more my own tism saying I've basically ignored this woman, and assumed that other people have too.
You said he has problems with problem solving and low process speed. Did I read that correctly?
Slow processing speed, yes.
Okay. When he's committing this offense, is he having problem solving issues and low processing speed?
My guess would be that if you look at this, and again, I did not talk about the offense, is that I think making decisions is difficult for him, and it would not surprise me if he did not have a well thought out plan about this. But I do not know that. I know he does not have a well thought out plan about many things, and I know his ability to process information effectively, both by testing, is very clear on the testing, and also by other people's evaluations, is limited. That's all I can answer.
You talked about Zero like being an imaginary friend. And you said that when it came to the interrogations, that was his way of talking to law enforcement. Was I right about that?
It was his way of trying to share what happened without, if the word wouldn't be taking responsibility, but it would be very difficult for him to talk about those things. And this is how he's learned to cope. This is something over the course of time. This is not new to this evaluation. To that interrogation.
But in that interrogation, whatever imaginary friend he created didn't actually tell the truth, did he?
No, I'm very well aware of that. Is that what he does is I used an imaginary friend example of a 4-year-old, but what we're really talking about here is a not integrated person who copes in a way to try to distance himself. Instead of being an integrated part of him, he distanced himself with a Zero. It's very easy to focus on Zero, but we have to focus on the totality of Tanner.
Well, you understand that when he was playing his imaginary friend, like you said, he was making up a consistent pattern of lies during the entire time, wasn't he?
There were a lot of it truth. That's true.
And he was also able inconsistently to make up a pattern of information, where things were, details, directions, and things like that, correct?
Well, many of them were not correct, but yes, he finally gave details that led to finding Athena.
But still stuck with his lie about backing into her and everything else.
Whatever that was, yes, he told a story that clearly was not true.
And he still lied about that in January of 26 when he got interviewed by Dr. Fritz.
I remember
Came
that.
back to that too.
Yes, I don't remember the month, but yeah, it was earlier this year.
So is his imaginary friend back when he's talking to Dr. Fritz?
His coping mechanisms are the same. His coping mechanisms of whatever his inability to tell the entire story is there. I didn't know that Dr. Fritz was going to ask him about the offense. I certainly was not.
So he copes by lying.
At times, he certainly does.
And he copes by avoiding responsibility by deflecting it off on anybody but Tanner.
Many times, yes.
Oh, look at the defense. Get some help. Drink some more water.
I think you mentioned before talking about theory of mind, and I believe you said, and correct me if I'm wrong here.
Certainly.
It's a problem with person having an understanding of other people's mental states, desires, intentions, emotions, things of that nature. Is that right?
I wish I was that articulate. You did that very well.
Well, I'm repeating what you said. So
I said that?
Yeah.
Oh, that was good. That, I'm proud of myself. Yeah, it's a difficulty in perceiving how other people perceive you, and a difficulty understanding like your own emotions. So it's this whole thing about how you perceive others and how they perceive you.
Right. And so what I look at that is, that's also how you understand other people perceive you, right?
Are you talking about me personally?
No. In this particular, since you're talking about here, it's also when a person like you're talking about, the theory of mind, it's also their understanding of how other people perceive them.
Yes, there's a lack of understanding about how my actions will be perceived by you.
Right.
Right.
And so I guess in that role, when I watched the first part of the kidnapping video, you'll agree with me that Tanner Horner knew that Athena would be upset, and that's why he covered her mouth to keep her from screaming.
I know that he covered her mouth to keep her screaming, and I'm sure that he knew that she would be upset.
Right. And he knew that that he was taking her to that first location where he stopped, and calmed her down and talked to her the entire time.
I do not know what was going through his mind. I cannot answer that because I don't know about the first location. I do not know the actual specifics that you might be addressing.
You didn't ask Tanner about it.
No, I did not. That was not my role.
Now, we talked about, I think you said that Tanner has difficulties in functioning in the outside world.
Well, yes, he does. He has marked inadequacies.
So things like having a relationship, job, friends, social life, being a parent, those are all problems for him.
All of them, yes.
But you'll agree with me that he had a job operating a FedEx truck for almost a year total, right? Isn't that right?
If you count, I guess, the two different contracts.
Yeah.
Yeah.
And so in doing that job, he would have to, operate the more simple task of operating a vehicle, right? But he would also have to operate it in a rural environment, correct?
Many of his routes were rural, yes.
He would also have to operate a GPS and operate package delivery, things of that nature, correct?
Probably so.
And you saw in the video where he's operating the FedEx device to be able to scan and deliver packages, correct?
Right.
And so, and he's doing all of that, and you don't see him having any problems doing all of that, do you?
Well, this is what I do know. He does all of those things. But when he changed the routes, he had really an internal breakdown. He had tremendous anxiety. He could not get to work on time. He had all kinds of other problems. So I don't know. I'm not saying Tanner has an average IQ. He is able to use a FedEx scanner. There's no doubt about it. My mail guy is able to do whatever he does with the mail, but he can't drive a truck because he has some kind of disability or impairment of some type. So yes, of course, no one has ever said that this is intellectual disability. Let me be very clear to the jury. Tanner is not intellectually disabled, which is what makes this case so complicated for everybody to consider. This is not, in the olden days, we called it mental retardation. That's not what we're talking about here. We're talking about a complex neurodevelopmental syndrome.
Ma'am, I'm going to stop you.
Yes.
Right there. Let me just go back to this here. You said he can't get to work on time.
Sometimes you can't. Sometimes he had no car.
He just got a new car at the time this happened, correct?
I think really recently to that. I don't remember the dates.
Right.
Yes.
And is it possible that him not getting to work on time is because he's partying on the weekends and doing cocaine?
That could be possible.
Is it possible that he can't get to work on time because he's playing video games and watching Dragon Ball Z all night?
Objection, Your Honor, that calls for speculation.
Overruled.
I don't know. I don't know. I know that he loves video games. I know that he watches TV. I also know, like other people on the spectrum, he's incredibly disorganized. Getting his life together, the way that they lived, which was horrendous, just dealing with the daily tasks of life were very confusing to him. He was inefficient. That's the best way I could put it. He was inefficient. And that's just a sign of his impairments.
So back to what we're talking about functioning in the outside world. You read Dr. Emhoff and Spence's report, correct?
Yes, sir.
Where they indicated that they felt satisfied that he had friends and things and a social life. You'll agree with that's what they said, right?
I'd have to look at the exact quote in the report, but I remember them saying that, yes, he had friends.
Okay. And he had a social life.
I don't remember those exact words, but if you say they're there, I'll take you at your
Well,
word.
let's talk about this. You'll agree with me that he did have a social life, being in bands, going out with his girlfriend, things of that nature.
Well, the bands were a failure, but he had friends. He did have friends.
Okay. And he had a social life. He went out, did things like normal people do, right?
Well, I don't know about normal, but he did go out and do things at times. They also stayed home a lot.
Okay. And then also was able to be a parent and have a child with his girlfriend, correct?
With as much outside help as possible from the mother's mother, who happened to be a nurse, and with as much help as possible from his grandmother. Despite his best desires and best efforts, it was incredibly difficult for them to take adequate care of that child.
But you agree with me, you said before that he had difficulty functioning in the outside world, but don't you agree that with job, friends, social life, parent, he is functioning adequately in the outside world?
Not if you take those apart functionally. No, I don't agree with that.
He's doing everything else that everybody else does in life, isn't he?
No, he's not.
Doesn't have a job, doesn't have friends, doesn't have a social life? How is that?
He's not doing that in a way that would be productive, in a way that's effective, in a way that would be reflective.
Millions of people are maladaptive and self-sabotagers. Are we Yes, people have self-destructive habits. Oh,
Of his IQ. He is not functioning. Yes, he has a job and he has a child that was incredible. As much as he loved that child, struggled to take care of. He has a jobs that were struggles. He has friends that are struggles. All of these, you can, again, we're getting back to the superficial. And my role here is to go beyond the superficial.
yeah, you're very nuanced, that jacket.
So you talked about a little bit about his development, that he needed interventions and things of that nature.
That's
Right.
correct, sir.
Okay. And again, and with regard to interventions, are you saying that if we had had those interventions, we wouldn't be here today? Is that what you're saying?
I think there's a possibility. Yes, I do. I think that Tanner would have taken a very different developmental trajectory had he had the services that he desperately needed when he was young.
So what he did in this case, the one thing I noticed you didn't mention is, did you ask him about what he did to Athena sexually?
He brought it up very generally, and I did not want to go into the offense, so he told me minimal.
Okay. So if he's catastrophizing, as Dr. Ryan said, and you seem to agree with that, that is his propensity. But he stops off in the middle and gratifies himself sexually in the middle?
I don't know if he gratified himself sexually. I really do not know. He mentioned one thing about it, and I did not go on with that because that was not my role to do.
What did he mention about it?
He said that he could not get an erection.
I have no words. My heart goes out to the family, to the friends that have to listen to this drivel being spouted off by an intellectual ivory tower elitist who has no idea the real pain that this man caused anyone.
That would imply that he was trying to.
Yes,
Did you read the DNA results?
I know the DNA result, that his DNA was found on her. I know that.
Yeah. You know where it was found on?
Second, Your Honor's mischaracterization of the evidence within the record.
I don't.
Wait, rephrase your question.
Just, she said she knew it was found on her. I just want to know if she knows where it was found.
Go ahead.
Where it was found? Where was it found on?
I don't have the specifics. No, I don't. I can't answer that question. I don't know.
That water cup's empty. She's not even drinking. It's a tick. It's a nervous habit. It's self-soothing, but there's no water in that cup. She didn't even swallow. Oh, she's about to cry. Maybe don't align with evil.
That's what you're trying. Redirect.
Yes, Your Honor. Dr. Pons, the state asked you about the video of the offense and specifically about putting a sticky note up on camera.
Correct.
Once that sticky note is up on that camera, can you see what happens?
Some of it, I can see him.
But after he puts the cover on the camera,
No,
can't see what's going on in there. So the state is asking you to make a lot of assumptions on what is going on at that time.
that's correct.
Are you able to state whether or not Tanner was having a meltdown when you can't physically see him?
No, I hope that was clear. I'm not testifying or hypothesizing or assuming what happened in that truck.
So if anybody were to get up on the stand and say, I don't see evidence of a meltdown, I do see evidence of a meltdown, I do see this, I don't see that.
All of your experts said they didn't see evidence of a meltdown. So again, you're going to need to explain what a meltdown is and how it is that your experts were able to say they did not see one. And then, because all of your experts say they didn't see any sort of or hear any sort of tension or meltdown from the transcripts.
All of those just based on assumptions,
They're all based on assumptions.
but no evidence.
That's correct.
Yours is all based on assumption and
regards to
supposition.
This grand criminal scheme and plan that Tanner is supposedly engaging in, would it make more sense for him to cover the camera before he abducted Athena or after?
Well, that's Tanner. It would have made much more sense for him to have the camera covered before any of this happened.
But that didn't happen in this case.
Certainly not.
So if he were actually planning to do something like this, would it make more sense to have covered the camera beforehand?
Oh, without a doubt.
With regards to Zero, you had stated that Zero was a coping mechanism. How important, or how does Zero tie into Tanner's propensity for avoidance?
It is a prime example of a propensity for avoidance. Tanner's coping mechanism, based upon his developmental issues, based upon the way that he was raised, is avoidance. Whether it's smoking weed or watching movies, as the prosecutor stated, until whatever time in the morning, or playing video games.
Now, you guys, it does look like okay, I have no idea what just happened. We're going to refresh this. I have no idea what just happened. That's weird. It does look like we're going to get a Texas Ranger or someone from the state, but I do have to stop at the end of this witness to go get the youngest, most ferals, which is why we're not skipping. I am sorry. I know she would be a prime candidate to skip.
What he did in his daily life, I would estimate his IQ to be lower than what was tested. Okay, that's how he functions, lower. But he is not, in quotes, mentally retarded. This is not a case about that. It's a complex issue.
Can someone have an active social life and still be impaired?
Of course, he did.
Can someone go out to the movies, the bar, restaurants, and still be impaired?
Yes,
Can someone have friends and still be impaired?
of course.
Can someone be a parent and still be impaired?
It's hard, but yes, you could still actually have a child, but it's difficult to do the complexities of parenting.
Can you drive a car, deliver a package, hold down a job, and still be impaired?
Well, getting back to the intellectual disability, there are many people who have IQs close to that developmentally delayed, in quotes, mentally retarded range. And they're serving you, they're cleaning the floors of McDonald's, and they're absolutely fine because they can do that type of simple, repetitive work. So just because you have an impairment doesn't mean that you can't work. It's how that impairment affects your functioning in real life.
And Dr. Brahms, you had used the phrase, go beyond the superficial.
Yes,
What did you mean by that?
I meant just what I testified to is that it is, okay, if we take a clinical situation, if you go take your child to a therapist, that therapist better go beyond the superficial. Or you should not come back, because they need to get to the core. You can say, you don't have to have a PhD, Ms. Anderson, to say they had a job, or they had a baby, or they had a girlfriend, or they had friends. The question is, what were those like? You mentioned going to a bar. He kept saying things at bars that
Y'all, I'll take the freeze. It's not popping me out. I have done all the things that Mr. Mo told me to do. So I'll take the freeze if it's just a couple seconds. Hurry up, ma'am. I don't want to listen to you babble much more.
really aggravate people, and he thought he was funny. He wasn't.
No.
But did he go to the bar? Yes. Was he socially appropriate and made tons of friends? No.
The state asked you about the facts of the offense several times.
Yes, they did, ma'am.
First of all, you are here because Tanner unalived a little girl. That is the entire reason, the nexus that you are here. The state asked me all about the questions about the crime. Like this was important. Oh my God. Because you're here to try to help us figure out, us lay people, you've had a bajillion and 12 years of school and probably the student debt to show for it. But you're supposed to sit here and explain to us how the hell Tanner came to be. And you seem to think that Tanner came to be because society wasn't nice enough to him and his mom didn't hug him enough. Well, I seem to think that it's because his mom didn't decide to take responsibility for anything. And he comes from a long line on both sides of people who refuse to take accountability and want to drown in, trauma and public, help for this and that, but not do it themselves. I'm sorry. This is how you get compassion fatigue. If you want people to not care, to have negative feelings, this is what you do. You use it as an excuse to justify horrendous behavior. And then you wonder why people have compassion fatigue. And J.K. Buck is right. At the bottom of this, we have a transcript of pure evil. Pure evil. And I don't recommend you go find it. I found it. I looked at it, and it hurt something. It broke something fundamentally inside of me. And I'm not trying to be, aggrandize it or anything like that. But the fact that real evil like this can exist and drive quietly and whistle a tune and go to Love's truck stop and clean out without vomiting, without any look on his face, with it being normal, there's something deeply, deeply, uncomfortable about the fact that a human being can do that, and I understand that why, that wanted to understand evil, has taken her down a clinical sort of tabula rasa of how, how did this happen? None of this makes a hill of beans when you look at that transcript, and I think that's the problem with the defense. At the end of the day, had this been a hit and run, like Tanner said, if that had been the fact pattern of the story, that he legitimately had backed into her and then unalived her, there hadn't been a stop or anything else, I think that this defense comes much more into play. Not as an excuse, but I think it's much more mitigating. What he did to that little girl, how he hid it, how he lied about it, and how he took home trophies, those are all things that he calculated and planned. Those weren't autism, those weren't fetal alcohol syndrome. Those were choices.
In this particular case, did we ask you to talk to Tanner about the facts of the crime?
No, you did not.
Would it be important for your evaluation, the development side of it, would it be important to that evaluation to know about the facts?
Oh, I had to know I had to know about the offense, obviously, Miss Anderson. But I did not, in no way would my understanding of his development have anything to do with what happened in that truck. I am here to talk about how he developed, who he is, what his limitations are, and in real life, what it means to have these neurodevelopmental impairments, not just a diagnosis or a test score, but what it means for him over the course of his life.
And lastly, Dr. Braun's state mentioned that you didn't write a report in this case.
That's correct.
Is that uncommon?
No.
But the state had the opportunity to speak with you before about your findings in this case.
Well, they didn't ask me. That's true. The state can call me. They had the chance to interview me in a Daubert hearing, so they knew what I was going to testify about. There's a pre-hearing where you talk about what you're going to testify about, and that was, I don't know, a couple months ago, maybe less than that, something like that.
Ma'am, because you're not a threat. Yes, they would have Daubert hearing the hell out of you if they actually thought you had a chance in hell of persuading anyone. You do realize that the state didn't find you credible enough to be a threat, right? That's why they didn't. Because whatever you say, they realize that it's going to go over like a turd in a punch bowl.
And they also have a right to contact me at other times. And you might want to have the defense attorney on the phone or on the Zoom with you, but it's their right to talk to me, and I would have talked to them.
Nothing further.
Mr. State?
Ma'am, Tanner Horner knew exactly what he was doing when he kidnapped Athena, didn't he?
I don't know that. I did not ask him about the offense.
He knew exactly what
He knew. It's a binary question. It's not like he was like, oh my gosh, bumped into a child and thought it was a box. He didn't think Athena was a delivery he was supposed to pick up.
he was doing when he sexually assaulted her.
If he's sexually assaulting her, he knew it was sexual assault. I will agree with that.
And he knew exactly what he was doing when he choked her and he beat her to death.
I know. I think that is true. I think he knew that would cause her great harm, if not death.
That's what, Ms. Anderson.
Nothing further, Your Honor.
May this witness be excused.
Yes, sir.
Thank you, ma'am.
Thank you, sir.
Well, you guys, I wish we could go back to another. Well, let's see if the defense rests.
Your Honor, ladies and gentlemen, the jury, the defense rests.
Thank you.
Let me see the lawyer. Just a minute.
Now, when we come back, we are going to be on rebuttal. Thank tiny baby Jeebus. I might have an adult beverage to celebrate that we are done with the defense. Thank you all so much for hanging out. I know I was a little bit at the bottom line, this expert does seem like a nice woman. I would probably enjoy having a conversation with her about these various issues and the need for early childhood intervention anytime. I don't like the way she was used here. I don't like the way she used anything. Rewind, Mo. So I will be back. We will be starting at 3. I think I put 3:15 or 3:10 just to give me a little padding in case uh let's see, pickup line goes a little bit late, but we will be back and finishing this up. Now, I believe that there will be 3 witnesses, rebuttal witnesses, but that was scuttlebutt from Court TV chat. So I don't know how accurate that is. And then we'll be working on uh, mom's response to resting. Let me see. Oh, let me move me.
Your Honor, ladies and gentlemen, the jury, the defense rests.
Let me see the lawyer. Just a minute.
All right, so I will be back at, let me double check what time I put this at because 3:10. So we will be back at 3:10 because the state is going to deliver some wonderful, some very needed logic. They're going to talk 50 shades of logic. They're going to make it rain logic and facts, and I am here for it. Thank goodness, finally. I would anticipate that we will get closing statements. If not tomorrow, then Wednesday. There might be an entire, well, I don't know that they'll have a charging conference. It'll be interesting since this is essentially the penalty phase, what kind of charging conference there will be, if any. So we will stay tuned and see what is in the afternoon and in store for us then. I will see you guys in just a little bit. I do have it so you are redirected, but share this out. If you know people that are like, oh my gosh, is the defense done? Let them know it's done. And, we are ready to go. Bye, you guys.